Good evening. Just a few housekeeping matters. Please, we're asking that you all remain muted unless you're asking a question or you've been asked a question. You may feel free to turn on your camera if you so wish. And we're also asking that after each presentation, if you have any questions for the presenter, that you either write it down or place it in the chat. And at the end of the webinar, we have a Q&A section that we'll have your questions answered. The term diabetes was first recorded in English text in 1425. However, in 1675, Thomas term mellitus under diabetes, which because of the sweet taste of the urine. Past President Michael Wilson, fellow Rotarians and guests, good evening. My name is Owen Coakley, and I am the moderator for this webinar today. We have a very exciting session planned for you and presenters, so we want you to relax on this blessed Saturday morning and just be entertained, informed, and given wealth of knowledge for the webinar. At this time, I'm going to call on past President Sam Bootle to open us up in a word of prayer.
Good morning. According to John's third epistle, verse 2, beloved, I pray that all may go well with you and that you may be in good health as it goes well with your soul. Let us pray. Heavenly Father, we give thanks and praise for this lovely day that you have given to us and for bringing us safely through the night. As we observe this World Diabetes Day, we pray that you guide the presenters of this webinar, bless those who are associated with it in any form. We pray that you guide our club and Rotarians all over the world, that we continue to do good work within our communities. Bless this land and help us as a people through this initiative and others to engage in healthy life practices. We ask these blessings in Jesus' name, and we pray as he taught us to pray. Our Father, who art in heaven, hallowed be thy name, thy kingdom come.
Thy will be done on earth as it is in heaven. Give us this day
our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom and the power and the glory, forever and ever. Amen. Thank you.
Thank you very much, past President Rotarian Reverend Sam Bootle. Coming to give us a warm and formal welcome is President of the Rotary Club of Nassau, President Michael Wilson.
Hi, good morning and welcome to all attending Rotarians and guest presenters. This is the first in a series of webinars on medical topics, and I'm sure it will prove very interesting to all attendees this morning. I want to send out a special thank you to Doctors Lightburn, Mitchell, and I see I got two cousins on here, Monroe and Lockhart, and also Melvin Davis and Justice Brown. Once again, thank you for attending, and I'm sure we're going to be having access to some privileged knowledge. Thank you, and welcome all.
Thank you very much, President Michael Wilson from the Rotary Club of Nassau. At this time, we are going to launch a poll of facts about diabetes at this time. Please feel free to tick the box, and then we will launch the results at the end.
Yeah, so we know as we go through our daily lives, you may not always be thinking about how we may be affected by diabetes. So this is just to give you something to think about, as you go through these questions. They're just a few questions. And at the end of the questions, like I said, we will give you the information. Okay, so you can look at as you answer each question, if you give yes to any of the questions, you see the points that are next to it, and then you can indicate your points at the end. And that will let you know if you need to, look further into, okay, is this something you need to be looking more into, or, or are you in great shape? So if you don't mind just going through the 5 questions. You may need to scroll down to see the other questions. Okay, I'll just give it another few seconds, another probably 30 seconds here, and then you see how everyone scored. But again, this is for you to think about, your own situation, your own activities, maybe there's some things you may need to look at changing. Okay, so like I said, just some things to think about and to think on as we are going through this webinar. We do have some good information to help you in the event that you do need assistance. So thank you very much. Owen, back over to you.
Thank you, Terry and Chantel, for that interesting poll. I hope most of you would give it some thought and consideration. I always used to say they have something called the body mass index chart. I always said that the chart is only good for Chinese because it don't work too good with us here in this part of the world. But I've been told that no, it's only one chart for everyone. So we need to take into advice the chart of our body mass index. I'm sure our presenters will speak to us more about that, and take control of our health.
Good morning, and good morning to everyone. Our first speaker is Dr. Arlington Lightbourne, primary care and lifestyle medicine physician. Dr. Lightbourne is president and CEO of Bahamas Wellness Healthy System, a community-focused multidisciplinary medical center headquartered in Meadow Point, Eleuthera, with branches in Spanish Wells and Lower Bogue, Eleuthera, as well as a Nassau branch, including its mobile division, house call doctors, and home care services. Dr. Lightbourne is dedicated to high-quality, affordable community health care, specifically on Eleuthera, teaching patients how to live long, healthy lives free of preventable illnesses. Proud father of 2, Matthew and Gabriel Lightbourne, let us welcome Dr. Arlington Lightbourne.
All right, good morning, everybody. It's indeed a pleasure to be, an honor to be invited to share on this really important topic, which, as we all know, is definitely the other pandemic, and is part of the reason why the current pandemic is such a significant one as far as death and hospitalization. And so it's really timely that we're having this conversation. I'm always excited to make myself available to do so. I've been given somewhat of a mission impossible, which is to speak about a passionate topic in 10 to 15 minutes. I will do my best, trying to skip over a couple of things. I've tried to shorten the presentation quite a bit, and hopefully we can reach that mark or just either above it or below it. So thank you guys very much again. So diabetes, we know diabetes in the dictionary as a lifelong, really horrible words, lifelong chronic disease that from, and there's very little they can do about it, and that they are doomed to taking insulin, and they will go blind, they will lose their kidneys, they will have a heart attack one day, and that will be the end of it. That is the message that someone wants us to hear. And that is what we've seen in many scenarios, simply because of the evolving knowledge about diabetes and what it does and what it really is. But in truth, diabetes or elevated blood sugar, blood pressure, high cholesterol, all of these are simply symptoms that result from problems with your diet, problems with your lifestyle, exposure to environmental toxins, etc., that interact with our unique genetic susceptibility. So they're all manifestations of the same problem or the same subset of problems. And just understanding a little bit about diabetes, insulin is the key that unlocks the glucose channel. So if you note this slide, you have a lock, which is on the cell. You have a key that insulin fits perfectly into, and that key opens up a channel that allows sugar to get in the cell so that the metabolic functions of the cell or life functions of the cell can be achieved or can be powered. And so if that doesn't happen, the cell will die. The problem with many of us is that we have too much of this glucose around and subsequently too much of the insulin around, and that causes a challenge, which we'll talk about. So what are the two types of diabetes? For this presentation, we're essentially speaking about type 2 diabetes. Type 1 diabetes is typically diagnosed in childhood. It is the result of the pancreas, which is the organ in your body that makes insulin. It fails in its function to do so. So the body simply does not make any insulin. And that person will, for now, because we currently have no cure, have to use a exogenous form of insulin, meaning a form of insulin that we get from elsewhere to inject into their bodies. That is not who we're speaking about today. We're speaking about the type 2 diabetics, ones who are making quite a bit of insulin. As a matter of fact, too much insulin, which is resulting in something called insulin resistance, where the key no longer fits into the lock. And that is because the cell, whose job is to take in the extra sugar, is only going to take as much as it can handle. And when it has bypassed or gone past that minimum amount or that maximum amount, it will change the lock such that the key no longer works. And that is called insulin resistance. So the cell is resistant to the insulin, which means the glucose channels don't open, and subsequently the blood is flooded with excess amounts of sugar. So type 2 diabetes is effectively insulin resistance. I'm not going to go over this slide. It's a little wordy, and we can talk about this at another presentation, but it begins in the liver. In a condition called non-alcoholic fatty liver disease. Non-alcoholic meaning that you can have fatty liver disease from alcohol, but in this case, it's non-alcoholic, usually due to excess saturated fats, excess sugars, in particular, excess fructose, which is something that we have seen significantly increasing in our diet since the 1980s and earlier, because of the production the global popularization of processed foods, and these processed foods needing to be sweetened, and the manufacturers looking for the cheapest form of sweetener, which is generally fructose, and more importantly, a particular product called high fructose corn syrup, which is linked significantly to fatty liver disease, which contributes to insulin resistance. And so non-alcoholic fatty liver disease is the result of an excess buildup of fat inside the liver. And that, as I said, is a result of excess sugar, because when your body cannot utilize sugar, it stores it, and it stores it as fat. And one of the first organ that happens in is your liver. And the excess fat results in insulin resistance, which causes increased blood sugar, which causes increased insulin resistance, which causes more fat, and that sets up a cycle. And so this slide is simply to show you that the cause of insulin resistance is insulin. So the problem with diabetics type 2 is insulin, and not primarily excess sugar, because insulin can be triggered by a number of different issues or a number of different problems. And understanding that holistic, interpretation of insulin resistance is important to managing type 2 diabetes in a complete way, and not so much just focusing on what am I eating. So it's a vicious cycle. So, high insulin levels causes insulin resistance. Insulin resistance, which causes high blood sugar. High blood sugar causes high insulin levels. High insulin levels causes more insulin resistance. More insulin resistance causes high blood sugar, et cetera, and the cycle continues. And this vicious cycle is what an expert in diabetes is trying to break. And that expert understands that a tablet or a drug is only part of that formula. And in many cases, at some point, will not even be necessary. So what are some of the causes of insulin resistance? We spoke about abdominal fat and obesity, lack of exercise, lack of quality sleep. Notice that is a really important one because of the influence of cortisol on insulin resistance. So you literally will never be able to completely manage and reverse your type 2 diabetes if you don't get good quality sleep. Excess carbs, which is just one of the causes, chronic illness and inflammation, and then obviously genetic susceptibility as well. So what are some of the manifestations of insulin resistance? Insulin resistance results in diabetes. We know that, elevated blood sugar, but it also causes hypertension. It also causes cholesterol issues. It also can lead to issues with your heart, issues with increased risk of blood clots, issues with neurological problems, even constipation. All of these are manifestations of insulin resistance. And so understanding that insulin resistance is a problem on its own is critical to understanding type 2 diabetes. So how do we measure insulin resistance? In the most indirect way, we measure it using something called an A1C, which all diabetics should know and be familiar with. And generally, an A1C that is less than 5.7% is considered normal. That person between 5.7 and 6.3 or 4 is considered pre-diabetes, a term I don't like. And over 6.5 is called diabetes. But I will mention it again in a future slide. Simply my belief that there's really no such thing as pre-diabetes. You're either diabetic or you're not. And anyone that is above an A1C of 5.7 should start managing that as if it is diabetes just as aggressively as if it was 6.6. So the term diabesity was coined many years ago to demonstrate the relationship between obesity and diabetes. And diabetes, the continuum of health problems ranging from mild insulin resistance to and overweight to obesity and diabetes, is the single biggest global health epidemic of our time. And this is without doubt a fact in the Western world. It is one of the leading causes of heart disease, dementia, cancer, premature death in the world, and is almost entirely caused by environmental and lifestyle factors. And that is the take-home point of this slide and my entire presentation, is that diabetes and the issues linked to it, the other manifestations of insulin resistance, are almost 100% preventable, which means that in the Western world, we are dying almost, we have the largest percentage of deaths are from problems that are completely preventable. So let's tackle some myths. Is diabetes genetic? The answer is sort of, but not really. While genes may load the gun, diet and lifestyle pull the trigger. So just because Grammy was diabetic and Mommy was diabetic does not mean that you must be diabetic. So I sometimes tell a joke that was not mine. I stole it. And the joke refers to a gentleman in a doctor's office who was saying to his doctor who was examining him, "You see, doctor, the problem is that obesity runs in my family." And the doctor said, no, the problem, sir, is that nobody runs in your family. And so while you may think this is your genetics, this is really your family members following the same general lifestyle policies or lifestyle trends. And so they are susceptible to the same health issues. Diabetes is almost entirely induced by environmental and lifestyle factors. Notice I said it again. So the statement is that diabetes, that some people say diabetes is not reversible. Again, this is absolutely not true. A matter of fact, a groundbreaking study, and they've been unequivocally that even people with advanced type 2 diabetes, when the pancreas is completely pooped out and the insulin producing cells are damaged, can recover and diabetes can be reversed. And they have been able to do so in some patient population in as little as 1 week, although these were in intensive lifestyle centers where patients were admitted and their entire lifestyle was controlled for that period. The point is, it is possible and it can be done under the right supervision and guidance and healthcare coordination. So another statement, pre-diabetes isn't a problem until it turns into full-blown diabetes. I said that already. Pre-diabetes is not pre-anything. And I said this many times. It is a deadly disease driving our biggest killers. The biggest causes of death in our country and the Western world are heart disease and cancers. And diabetes is the leading cause of both of them as far as risk factors. And so there's nothing pre about it. People with A1Cs that are in the so-called pre-diabetic range have the same micro complications already developing as somebody who has a higher A1C. And therefore, if your A1C is above 5.7 and you're not a diabetic, you're not diagnosed with diabetes as though you are, and make dramatic changes, because that label does not always have to be with you. Diabetes is reversible. Another statement, once you start insulin, there is no going back. Again, wrong. As a matter of fact, I've had now probably thousands of patients with aggressive lifestyle intervention and dietary change. We have gotten them off of insulin. Now, these are patients with type 2 diabetes who are usually also obese. These are not your type 1 diabetics who are typically slim, skinny individuals who would have had it from childhood. Those individuals aren't making any insulin. But if we can prove through tests that you are a type 2 diabetic, which means your pancreas is still making quite a bit of insulin, your lifestyle can get you off of it. Another statement, lowering blood sugar with medication prevents death and heart attacks. Again, this is not true. This is a dangerous myth. And so here's my biggest issue with most of the treatment approaches to type 2 diabetes. Biggest issue is that the worst outcomes of type 2 diabetes are usually heart disease, heart attacks and strokes. Most of the medications that are used to treat type 2 diabetes do very little to reduce that end goal, that end outcome, not goal, but that point that we're trying to prevent. So if you're doing something hoping that this is going to keep you alive as far as preventing a heart attack, and you find out that the medication is doing very little to do that, it really, brings a lot of questions to why we're taking this approach. Why that shows through research that if you do these things, you're going to live a longer, healthier life. And the only thing that has been shown to significantly improve life expectancy and quality of life in people with diabetes is a healthy lifestyle, not just medications. So we have to give up on the hope for the magic pill that will fix our problems. And this is how we are built, right? Ever since the penicillin era, a pill for every ill. We believe that we can continue living the lifestyle we choose so long as we take our pills. That is a dangerous myth, and we've got to understand that the power to change our health issues in many cases lies in what we put in our mouth, how much sleep we get, who we surround ourselves with, and how much exercise we do. Another statement, weight loss is necessary for reversal of diabetes. Not really. So I've had many patients who, through just lifestyle changes with only moderate changes in weight, have been able to reverse their diabetes or achieve A1Cs of less than 5.7. Achieving optimal weight is desirable and a good goal for long-term health, but it is not necessary to rebalance your blood sugar. Perhaps more to the point, the rush to weight loss surgery. So everyone says, I'm going to get this gastric bypass and that's going to fix me. But if you don't change your lifestyle, that gastric bypass is just an expensive rubber band on your or surgical procedure that you are going to end up back where you began. So changing your diet and your lifestyle is a real cure. Last couple of slides. So there's this really important research tested program called CHIP that was discovered and founded and implemented by the Lifestyle Medicine Institute, of which I'm a member. And it has had tremendous success, publishing more than 40 scientific articles showing the reversibility of type 2 diabetes. And I mention this because I don't want anyone to think that Dr. Lightburn is talking or said. There is tremendous research to show that type 2 diabetes can be reversed with a healthy lifestyle. And one just needs to check this program and look at some of those articles for evidence of that. My company, Bahamas Wellness, has adopted a version of this chip, and we've adopted this for the last 4 years, where we have physicians and nutritionists working hand in hand with patients in lifestyle programs, and we're seeing the same kinds of results with patients that are consistent and that are committed to the change, and not just reversing type 2 diabetes, but all of the lifestyle illnesses, including obesity, hypertension, and high cholesterol, which, as I've said, are not really individual diseases, but rather different manifestations of the same underlying problem. And so the take-home message here is that diabetes is almost completely a reversible lifestyle, have the power to both prevent and reverse it. Spread the word. I would have gone into more detail about your diet, about exercise, and showing you some more evidence of that, but I would not have had time. And I know that Justice Brown, who is our lead nutritionist, who is a part of this presentation, and others will go into that. So I hope that this has been beneficial to you. Thank you very much.
Thank you very much, Dr. Lightburn, for that powerful and thought-provoking presentation. Just to highlight some little tidbits from his presentation, he talked about the 2 types of diabetes. He talked about the A1C level, and that being anything less than 5.7 being normal, 5.7 to 6.4 being pre-diabetes, and anything 6.5 and over being a diabetic. He also talked about how diabetes can be reversed with the necessary lifestyle changes. And some of those major changes include sleep, exercise, and of course, what we eat. Now I have a trivia for you. and I'm probably gonna need persons to assist me. Can somebody raise their virtual hand or unmute your mic and state the substance that is used to unlock the cell to take in the sugar? Can anybody just talk, except the presenters, can anybody say what is the substance that is used as a key to unlock the cell so that it can take in the sugar? Anybody? Erica? Unmute yourself.
Is it insulin?
That is correct. That is correct, Erica. Okay, and you have won yourself a gift certificate that you would be able to pick up on Tuesday at Logos Bookstore in the Harbor Bay Shopping Center. So thank you, congratulations, Erica. Okay.
Thank you.
Now, I was supposed to be having a presentation from the Diabetic Research Institute, but I don't see her on the call. Philip Duncombe, would you be able to call from the Diabetic Educators Association? Would you be able to switch now or?
Good morning.
Okay.
Can you hear me?
Yeah, yes, we can.
Okay, good morning. Okay, now, yes, I do represent the Diabetic Educators Association of the Bahamas. I'm a registered pharmacist for the last 30 years, and I've been involved in diabetes on and off from 2012, at least focusing on diabetes from about 2012. And I got certified as an educator in 2019. Before I forget, there's something that Dr. Lightbourne said, and good morning all. There's something that Dr. Lightbourne said concerning pre-diabetes. And I want to stress the fact that we may have, I'll throw the figure. For every one diabetic that we have in this country, we may have about 3 to 4, and he don't like the term pre-diabetics. So I'll just refer to them as individuals who have not been diagnosed, who are not showing what we define as diabetes, and that's elevated sugar levels above 100 milligrams per deciliter. So we do have a large percentage of these individuals who are suffering from insulin resistance, are showing signs of metabolic syndrome. And these individuals display no signs. In fact, no test will actually pick up that they are on the way to becoming diabetics, but they do exhibit physical signs or relationships, like having a mother or father, a sister or brother who is a diabetic, having a waist circumference at 40, and you don't really have to be obese, but you can be moving up there, so we can actually detect this. If you're in a male, if you're at 40 inches in your waist, 35 inches at the waist for a female. Blood pressure around 130 and 80, but rising or getting, showing signs that it's gonna be above that. Lack of activity, not having a sedimentary lifestyle, all these things actually would give a signal to a health professional that you may be at risk. So these are risk signs of diabetes, which can manifest itself 10 years, 5 to 10 years before you've been diagnosed. And during that period, insulin resistance, like Dr. Lightman mentioned, would start to increase due to high levels of sugar in your bloodstream. The body works to compensate and to bring down the sugar levels due to high consumption of carbs in meals. And what happens is it goes on for a period, like I said, 5, 10 years out with no symptoms. But eventually, 7 years old, 5 years old, you start to develop microvascular problems, macrovascular problems. And usually when someone is diagnosed with an A1C of 7 or above, 6.5 and above, which we define as clinically diabetic, you may have already lost 80% of your beta cells that produce and release insulin into your bloodstream to bring down your sugar. So you may be at a disadvantage at your diagnosis. Now, I go back to this pre-diabetic thing because it is so important to catch it early, because all this destruction of the beta cells can be avoided if lifestyle changes are applied. Now, as a diabetic educator, our focus is actually on bringing education and tools to individuals who suffer from diabetes, who are being diagnosed with diabetes. But our focus is also on those individuals who may be exhibiting, like I said, metabolic syndrome, or actually are getting readings on their fasting glucose at, say, 100 to 120, because now you're realizing that the body is losing its ability to maintain that fasting glucose below 100. Can you hear me? Hello?
Yes, we can.
Yes, we can hear you.
We can hear you.
Okay, all right, thanks. Yeah, so like I said, we focus on behavioral changes on both sides of the diagnosis. And we focus on, first and foremost, nutrition. And as part of a group of, there's multiple disciplinary individuals a part of this group. I see on the flyer that my colleague, as a diabetic educator, Dr. Monique Mitchell, is a part of this group. We have, and she's a podiatrist, we have dietitians, I'm a pharmacist, we have nurses, we have doctors, we have a physiotherapist, we have, so it's a broad spectrum of professionals. And to be qualified to become a certified diabetic educator, you must first have some professional healthcare training. So we collaborate with each other through referrals to make sure that we focus on, like I said, first and foremost, nutrition, then exercise, and these are all lifestyle behavioral changes that we can encourage diabetics and pre-diabetics to make changes in. We also focus on glucose monitoring, which is important because if you don't measure it, you can't manage it. We focus on behaviors like taking medication because we have a problem with compliance and adherence. We have individuals who become fatigued, medication fatigue. They just don't want to take the medication anymore. Or we have individuals who don't understand the mode of actions of their medication, so they take it at inappropriate times. There's so many things that could go wrong with medication administration. So we focus on educating the patient with information that allow them to optimize the use of the medication. We deal with problem solving. A diabetic on a sick day, any diabetic who experiences a sick day knows that they're at risk of hyperglycemia, which is elevated sugars in the blood, which can spike at any moment. So how to manage and monitor. It requires a stricter attention to your readings and your medication. And sometimes even someone who's just on oral medication may require fast-acting insulin. We deal also with health coping. And this could involve stress, emotional stress. That can also cause the body to respond in a way that counterbalancing hormones can be released and interfere with the insulin that's being produced by the body and also cause spikes. Reducing risk is another way of correcting behavioral lifestyle, and Dr. Lightborn mentions the fact that sleep is important. This, by getting the sleep, you're reducing the risk of actually causing the disease to progress more rapidly than it needs to. And the purpose is to delay or slow down, or better yet, reverse the disease. And we see this in the reduction in long-term complications like blindness, which is maybe diabetes could be the number one cause of blindness in the Bahamas right now. Amputation, diabetes, more than likely, and this is non-trauma associated amputations, just losing a limb because of gangrene and nerve damage, poor circulation. Diabetes is the number one cause of amputations. Also, kidney disease. There's also a brain component with a form of dementia being developed early in individuals that has nothing to do with aging. That's caused by insulin resistance. There's also the contribution of other comorbidities like Doctor mentioned, hypertension, high cholesterol that leads to cardiovascular disease, which may be the number one killer of Black Bahamians or Black individuals around the world. Approach is structured, is standardized, is recognized globally as done the same way in Canada, India, Australia, and the United States, where we actually apply the same system that nurses use. It's called a PI, where we do an assessment, where we determine the patient's level of understanding, level of learning, knowledge. We deal with to determine their finances, where they have support. It's a whole gambit of questions we ask, we seek answers, and then we come up with a plan. Very simple plans based on being specific to that particular person, something that can be something that is attainable, realistic, and timely. So if we find that the patient wants to start some physical activity, we can either refer them to someone who can work with them when it comes to exercise, or if they just want to do something simple like walking, we can set goals that are goals that can be.
Mr. Duncombe?
Yes, sir.
Just 1 second. I don't want to cut in. Just give us.
This is something that I'm passionate about, but okay. What we do is actually educate our clients, get them in the position where they do work that's required outside the doctor's office. Like Dr. Lightburn said, a lot of patients depend on this medication, those who are compliant, and they figure the medication will resolve their problem. But basically, it is what they do outside the doctor's office between the visits that actually reduce these outcomes that can be detrimental and destroy the quality of their lives and maybe even cause death. So we just focus on the patient having that knowledge and skill base to help themselves and in order to survive this deadly illness. I'll wrap up then, and I apologize for going over my time.
Thank you very much, Mr. Philip Duncombe from the Bahamas Diabetic Educators Association. I do apologize for having to interrupt into your presentation. Coming now to introduce our second speaker is Rotarian Wayne Miller.
Hi, and good morning to all. Our third speaker is Rotarian Anita Dean. Rotarian Anita Dean graduated from the New England School of Optometry, Boston, Massachusetts in 1992. She is an American board certified optometrist with licenses to practice in the state of Florida and the Commonwealth of the Bahamas. Dr. Dean has also worked in the Bascom Palmer Eye Institution in Miami, Florida. She opened her own practice, MJB Optical, in May 2004, which is located in the Bates Road Shopping Plaza, Nassau Street. The practice also provides services to residents of Eleuthera at the Eleuthera Medical Center, Palmetto Point. Rotarian Anita is married to Kevin Dean, and they are the proud parents of 2 children. She enjoys traveling and spending time with her family. Ladies and gentlemen, please help me welcome now to bring a presentation to us, our Rotarian Anita Dean, to advise us on the importance of eye care. Thank you so much.
Thank you. Thank you. Good morning to all. Thank you for that introduction, Rotarian Miller. My task today is to really talk about diabetic eye problems and how high blood sugar can affect your vision. So just a little introduction. If you don't know, complications from diabetes can harm one of our most important prized possessions, our eyesight. In fact, diabetes is the primary cause of blindness in adults worldwide between the ages of 20 and 74. Diabetic eye disease. This is really referring to a group of eye conditions that results from being diabetic. And these include blurry vision or fluctuating vision, cataracts, glaucoma, and diabetic retinopathy. So blurry vision occurs when the lens inside your eyes swells secondary to fluid building up in the lens. And a lot of times this can occur even before. So sometimes patients come into the office and they're just thinking they need glasses. And when we check their blood sugar count, we find out that it's very high. So a lot of times, if that is the case, or if I have patients that are just recent onset diabetics, I try to hold off on prescribing glasses at that point in time. We can get you back to 20/20 at that point, but that is not a realistic prescription because of the issues with the lens inside your eyes. So I try to hold off in prescribing glasses at that point until we know that the sugar level has stabilized. And usually I would have the patient come back within 2 months or more. The only time I really prescribe the glasses if the person is really having issues functioning. They're complaining about headaches or whatever, and they really can't see. So we'll give them a temporary pair of glasses, knowing that that is not the final prescription. Cataracts. This is when your natural lens becomes very cloudy. So if you see here, the above the first slide here, picture, this is how a normal lens should look, very clear to allow light to get into the back of the eyes. When you have a cataract, it looks like this. So as you see, it will make the vision very hazy and blurry. Sometimes people come in complaining about seeing halos around lights, streaks of lights. And realistically, diabetics have a 2 to 5 times more chance of getting cataracts than the general population. And usually it's early in life. We have age-related cataracts that usually we can see changes at the age of 60 or above. But with diabetics, sometimes cataracts can develop as early as 30. I've had patients in their 30s that have had cataracts, and the treatment form is actually surgery. So you have to remove this lens, your natural lens, and it's replaced with an artificial one. Glaucoma. This type of glaucoma is where diabetics are at a higher risk. This glaucoma is called neovascular glaucoma, and it's actually when you see these blood vessels growing onto the colored part of the eyes, and these new blood vessels tend to block the normal flow of fluid in the eyes, which can lead to high pressures of the eyes. And if you have high pressures of the eyes, this can cause pressure to the back of the eyes, the nerve, and it actually can lead to blindness, because if the nerve gets damaged, if the nerve is killed, it's like having a stroke. And that is irreversible at this time. So treatments for this kind of glaucoma, the primary goal realistically is to try and reverse those new blood vessels in the eyes. And we do that using laser, just to try to block or actually reduce the number of blood vessels in the back of the eyes. Another way is actually to use an anti-VEGF injection which actually inhibits the growth of these new blood vessels. These blood vessels grow because it's registered in the body that there is areas of ischemia or areas that are lacking normal blood flow. That's what causes issues with leaking and everything. And in conjunction with these, you also will use eye drops to try to decrease that pressure in the eye as quickly as possible. Again, like I said, to prevent nerve damage and leading to blindness. Diabetic retinopathy. This occurs obviously with, again, when we have changes in the back of the eyes, when blood vessels tend to leak and you have blood onto the nerve, the retina, and also fluids. So you can actually have, like you see in this picture, where there's fluid in the center part of the retina. And this actually is called diabetic maculopathy because the center part of our retina is where we have the sharpest vision. So people will come in really complaining of decreased vision. And if you look, you'll end up seeing fluid in that center part. This second picture also shows, again, these new blood vessels, these tiny blood vessels that are not really supposed to be there. And they're the ones that cause a lot of issues in terms of leakage and everything else. So this, again, the treatment for this, and if left untreated, because the retina itself is nerve tissue. And when you have blood or fluid sitting on the nerve too long, it will kill the tissue, the retina. So the key is to try and get that blood or fluid off of the retina as quickly as possible. Sometimes, even just like how Dr. Lightburn spoke of, sometimes just doing lifestyle changes, we can see these things reverse because the body has a way of healing itself. But if it sits too long, then again, we have to go for treatments. And it's the same as the treatments that I spoke of with neovascular glaucoma, using laser or anti-VEG injections. That's like, if some diabetics have had it before, it's like Avastin. That's an example of the injection. So here are some eye care tips for diabetics. Once you have been diagnosed, the important thing is to get a diabetic screening from your eye doctor. So have an eye examination, dilation, so we can see what is going on and be able to address situations in advance. If everything is okay at that initial examination, then annual checkups are needed. Diabetics, annual exams are not just only for that you could see a chart. We actually have to check the health of the eyes, and this is with everybody as well. The health of the eye is very important because some of these things can be happening in your eyes that you are unaware of. And we always say early detection and treatment can save your vision and prevent blindness. So sometimes you may be walking around and not knowing what is going on. And the only way you would know is through an eye exam. A lot of times I've had patients come into me just for a regular eye exam. They just want to change their glasses. And I look into the back of the eyes and I'm seeing diabetic changes and they've not even been diagnosed. So this is where it's very important, because a lot of people think that just eye exams is, if I can see, okay, I don't need to have an eye exam, but it's a part of a routine, taking care and maintaining your health. You have to have your physical every year. Dr. Monroe is going to soon be talking about making sure your teeth are being seen. on a routine basis. Dr. Mitchell is going to be talking about your feet, but your eyes as well. Those are key important team to be able to make sure that all aspects, because diabetes affects every aspect of your body. So all of us play a role in that to ensure that you stay as healthy as possible. And if you can, if it is reversible with lifestyle, then that is done. And we also will be following you up annually, if not before that, to ensure that that is happening. When is it time to call your doctor? If you're having some symptoms or signs, and these are can be emergencies, if you notice flashing lights, because this can be an indication that there might be a retinal issue going on, there might be a retinal detachment or tear or hole, dark spots in your vision. And this picture shows like how sometimes diabetics see the world. Those dark spots can be signs of what we talked about suddenly, when that drainage system is blocked, that is sign swollen. It could be a retinal detachment, a sign of changes, the retina, some kind of retinal detachment. And if you have any sudden eye changes, you should contact your doctor or come in, because then we definitely will check to make sure and see if there's any issues that we need to address. So here is a ABC of diabetes to protect your eye health. A is definitely try to manage your A1C, and Dr. Lightburn talked about the numbers that you need to be able to reach. So having your A1C checked and being on top of that helps. Blood pressure we talked about as well, making sure blood pressure is stable. Cholesterol, C, D, because smoking actually does affect blood vessels. And as you see, diabetes, blood pressure, all of these are vascular disorders. And again, E, definitely make sure you're getting your eyes checked annually with a dilated exam. And I am leaving you with this, one of my favorite quotes. It says, "The eye is the lamp of the body." So if your eye is healthy, your whole body will be filled of light. And the key is to keep your eyes healthy, because the eye is the window for you to the world. So if your eye is healthy, then your whole body will continue to see and be filled with light. End of my presentation.
Thank you very much, Dr. Anita Dean, for that empowering presentation full of knowledge. And moving right along, we're just gonna add a trivia. We're gonna go on. What do you call this, where the natural cells become cloudy? I need someone to raise their virtual hands. When the natural cells in the lens, when the natural lens in the eye become cloudy, what is that called?
Cataract.
What's that?
Cataract.
Who's that saying that?
This is Jacqueline Popu Duncan.
Rachel Duncan?
Yes, sir.
Okay, Rachel Duncan, you are correct. And again, you can pick up your prize at Logos Bookstore in the Harbor Bay Shopping Center on Tuesday. Congratulations.
Thank you, sir.
Coming now to introduce our next speaker will be Rotarian Donnelly Bowe.
Good morning, Rotarian. It is my pleasure to introduce Dr. Dervin Monroe, who is the chief dentist at the Medi Center Dental Suite located on Prince Charles Drive. Dr. Monroe has obtained a DDS degree from the State University of New York at the Buffalo School of Dental Medicine, and he has a minor also in aesthetic dentistry, which he obtained in 1996. He has a postdoctoral training in dental implantology and advanced dental dentistry. Dr. Monroe utilizes the latest technology in his treatment modalities. Fellow Rotarians and guests, please welcome Dr. Dervin Monroe.
Well, good morning, Rotarians and guests. And thank you, Ms. Bowe, for that introduction. With that, we'll jump right into this presentation. Diabetes can take a toll on the entire body. And as discussed earlier by the other presenters, it can be quite a toll to take for the human body. In dentistry, we tend to look out for the following things in a diabetic patient: periodontal disease, tooth decay, fungal infections, and dry burning mouth syndrome, as well as a few other conditions. The most significant of these is periodontal disease. Periodontal disease is a set of inflammatory conditions affecting the supporting structures around the teeth, those being the gingiva, the gums, and the bone. In its initial stages, we refer to the initial stage of periodontal disease as gingivitis, which is basically an inflammation of the gingiva or the gums around the teeth. At this point, this condition is completely reversible by proper brushing, flossing, and having your teeth cleaned. If nothing is done, however, to reverse this, it will progress to early periodontitis, which again is an inflammation of the gingiva, and maybe at this point there's slight bone loss. Again, this is reversible. Proper brushing, flossing, having your teeth clean, you can reverse the early periodontitis. But again, if nothing is done, we will progress to moderate periodontitis, which is inflammation of the gums and a moderate amount of bone loss around those teeth. If nothing is done, we will progress to advanced periodontitis, which is inflammation of the gums, loss of some gum tissue, and loss of a significant amount of bone around those teeth. Gingivitis in pictorial form is an accumulation of the plaque around teeth and its effects on the gingiva, or the gums. Everybody can see this slide, I hope.
Yes.
Yes.
Yes. Okay,
Yeah.
so there's an irritation to the gums around the bone, early form gingivitis. If it's cleaned and removed properly, we will revert to a normal, healthy gum tissue around the tooth. If it isn't, there's more accumulation of plaque. You would see that the gums pull away from the root of the tooth, and you have slight bone loss occurring. You will also have a pocket developing around the roots of the teeth. And that pocket is similar to the pockets on your garments. It's there to hold something. in the mouth, that is exactly what happens. More food debris and plaque will get trapped in between the teeth when you progress on to moderate periodontitis. More plaque development, more irritation to the gums, more bone loss. If nothing is done in this regard, you tend to get an even greater amount of plaque developing on the roots of the teeth, have a greater amount of bone loss, and eventually the entire tooth will be lost. Now, in the diabetic patients, this process of going from gingivitis to advanced periodontitis tends to be sped up quite a bit because of the inability to heal in a normal fashion. If the body cannot remove the plaque and the toxins that develop from accumulation around the roots of the teeth, they tend to sit there and cause a destruction of gum tissue and the bone. The connection between diabetes and gum disease is a two-way street. The research has shown that serious gum disease and diabetes is a circular relationship. Not only are people with diabetes more susceptible to serious gum disease, but serious gum disease may make diabetes worse by affecting the blood glucose levels. And this is important. Diabetics are 2 to 4 times more susceptible to gum disease due to poor blood glucose levels. Gum infection further decreases blood glucose control and increases insulin resistance and hypoglycemia. High blood glucose levels makes fighting infections more difficult and causes more severe gum disease. More severe gum disease can increase blood glucose levels, further contributing to the increased periods of time with high blood sugars. So you can see that it's a hand-in-hand relationship. This bears mentioning again. Gum disease is linked to high blood glucose control. People with poor blood sugar control get gum disease more often, more severely, and they tend to lose more teeth. We surmise that blood vessel changes, blood vessels that deliver oxygen and nutrients to the body are affected. Diabetes causes blood vessels to thicken, which slows the flow of nutrients and the removal of harmful waste, increasing the risk of gum infection. With the accumulation of bacteria in the mouth, many kinds of bacteria will thrive on sugars, including those involved with high glucose levels in the body. When diabetes is poorly controlled, high glucose levels in saliva enables germs to grow and set the stage for gum disease. This aspect is very important, and I will talk on that in a few seconds. As mentioned by Dr. Dean, if you're a smoker and a diabetic and you have periodontal disease, that's bad news. You will tend to lose more teeth very quickly. So if you are, it's advised that you stop smoking and get your diabetes under control. Diabetes and tooth decay. A decreased saliva production in diabetics and an increase in sugars of the saliva elevates the potential for tooth decay. Imagine diabetes will affect or can affect the salivary glands, making them produce less saliva. Saliva itself acts as a lubricant and a rinse to rinse away bacteria and food debris in the mouth. But imagine a decreased production of saliva, and the saliva will tend to have more sugars in it. So imagine the teeth being constantly bathed in less saliva first, and secondly, saliva that has a high sugar content. That's the perfect storm for the development of tooth decay. Those bacteria in the mouth will take the sugars and the food debris and produce an acid, which then causes rampant tooth decay if allowed. The other aspect that we tend to look out for in diabetic patients is fungal infections. So people with high blood glucose levels are more likely to develop oral infections such as thrush, which is an infection of the Candida fungus. Treatment of the fungus infection. Treatment of the fungus infection mean using some medication, some antifungal medications or creams, and also evaluation of the patient's diabetes in general. It may require a referral to their physician to have that evaluation done. This is a depiction of an individual that has a dry, burning mouth syndrome. It is believed to be due to the effects of diabetes on the nerves of the saliva gland and the nerves in the mouth. With a decrease in the saliva production by the saliva glands in the mouth, will tend to be dry, and as an effect, you'll tend to burn. Some patients describe this burn as putting a hot instrument in their mouth. It's quite uncomfortable, as I am told. Treatment of this will mean sometimes will mean for us to have the patient get artificial saliva to lubricate the mouth, and also chewing sugar-free gum, which is hoped that will promote the saliva glands to produce more saliva. In review, individuals with diabetes will tend to have conditions of periodontal disease, tooth decay, fungal infections, and a dry, burning mouth, along with a few other issues. The recommendation for those individuals would be medically to have their medications checked, evaluated by their physicians, and patient compliance with those recommendations by their physicians. It makes no sense to have the medication and using it once, or using it at the times where they're not supposed to be utilized. And of course, frequent monitoring of your blood glucose levels will help to better understand what your body is doing at particular points. Dentally, we promote proper daily oral hygiene care, and that's proper brushing, proper flossing, and use of an antiseptic mouth rinse, and of course, regular professional dental care. Diabetics, we recommend that they have their teeth cleaned a bit more frequently than individuals that do not have diabetes. Perhaps every 3 or 4 months, you can come in and have your teeth cleaned and evaluated. This is an imagery of an individual that is diabetic and does not take optimal care of their teeth. You can see that the gums are puffy, red, swollen, and looks angry. Same thing down here. But with proper care, proper control of your diabetes, proper dental care, we can go from this condition to these conditions. Much better scenario to have in your mouth. Ladies and gentlemen, I thank you for your attention. And I will stick around for any questions that you may have a little later on in this presentation.
Thank you very much, Dr. Durbin Monroe, for that informative presentation. And now for our trivia. Can somebody raise their virtual hands and tell me what is thrush? Anybody?
Candida of the mouth.
That's Mr. Ferguson. That's Sandy Ferguson who said that? Hello?
Veronica. Veronica.
Veronica Ferguson?
No, Veronica Campbell.
Veronica Campbell. Veronica Campbell, you are correct. And again, you can pick up your gift certificate at Logos Bookstore on Tuesday. Coming now, in the interest of time, we're going to move right along to our next prepared presenter. And coming now to introduce her is Rotarian Sophia Walker.
Good morning to all. Dr. Monique Mitchell is a proud alumnus of the R.M. Bailey Senior High School and the University of the Bahamas. She completed an Associate of Science degree in nursing in 1988 in the second inaugural class. She worked as a registered nurse in medical, surgical, and psychiatric settings. She holds a Bachelor of Science in nursing with a minor in community health from the University of Central Oklahoma in Edmond, Oklahoma. Here she developed a love for community health. She went on to complete a Master of Public Health in Health Promotion and Education from East Tennessee State University in Johnson City, Tennessee. She became a certified health education specialist and loved working as a health educator, developing health promotion programs and helping people learn to live healthy lives. While working in diabetes education, she discovered her next career. Since returning home, she developed the Feet Can Last a Lifetime Diabetic Foot Lay Educators Program and is actively involved in training health professionals on diabetic foot screening and prevention of complications. She is a founding member of the Bahamas chapter of SAL, which is Save a Leg, Save a Life, which hosted the Diabetic Foot Symposium for several years. She is a member of the recently formed Bahamas Podiatric Medical Association and serves as the vice president. She is both a Caribbean and Bahamian certified diabetes educator. She is employed with the Ministry of Health for the past 32 years and has been in private practice as a podiatrist in New Providence and Grand Bahama for 12 years. She has special interests in community health, wellness, and health promotion. She is actively involved in community-based health programs such as 8 Weeks to Wellness and I Choose to Live Healthy. She is happily married and enjoys many recreational pursuits such as photography, stamp collecting, and walking. Please welcome Dr. Monique Mitchell.
Good morning, everyone. Thank you very much for having me. And okay, so this morning we're going to do a little review of diabetes on the feet, the effect of diabetes on the feet. Our objectives are, we want to recognize the impact of diabetes on the feet. We want to look at 2 ways, at least 2 steps persons can take to prevent complications in their feet, and then to identify when and where to get diabetic foot care as needed. So let's jump right in. So diabetes and the feet. We've heard some excellent information so far about diabetes, the impact it has on the whole body, as well as how we can actually reverse it. And so today we're going to be focused right now. We're going to focus on the feet. So Dr. Livingston and the previous 2 speakers also talked about the impact of uncontrolled high blood sugar. So as a result of uncontrolled high blood sugar, it also affects the feet all over the body, but it causes permanent changes to the feet that puts all diabetic feet at high risk. Could be for ulcers that take a long time to heal, infections, as well as amputations. And recently, the research is showing that it actually increases the risk of early death or premature death as well because of the amputation. So we're going to look at how that occurs and how persons with diabetes can actually prevent that from happening. So the first step is to look feet. And these are healthy feet that we're looking at here. And I promise I'm not going to show you any pictures, not too much anyway. But definitely diabetes affect the feet. I'd like to say 5 ways or 5 systems that the diabetes affect in the lower extremity or the feet. And the first one is it causes decreased blood flow to the feet. Okay, so this high blood sugar causes decreased blood flow because of Dr. Livingston talked about earlier about the impact of diabetes on how it affects the actual functioning of the cells. So in this case, it affects the blood vessels and it causes peripheral arterial disease, which decreases the blood flow to the feet, and it actually slows down or prevents wound healing at all. And then it can actually lead to gangrene or amputations as well. A second system that it affects is the nerves. It looks at the blood sugar. Again, it damages those nerves. And you know, the nerves are the parts of our bodies that we feel with, tips of our fingers, tips of the toes, all over. So oftentimes persons would develop loss of sensation or loss of feeling in the feet, in the hands. They would get numbness, tingling, burning. And so those are common symptoms of person. Oftentimes, those are the symptoms that persons have at first, and that would bring them in to see a podiatrist because they're having these symptoms and they don't relate it to the diabetes. They think because it's occurring in the feet, they want to get the feet checked out. So oftentimes persons would come and then we would have to check. We have a HbA1c in our office as well. We would do a finger stick, and then sometimes we'd send them back to their primary doctor to get a full workup and a diagnosis because they've come before they were actually diagnosed. So the third system would be the structure of the feet. So these are called deformities. Once the structure of the foot changes, and in this picture here, you can see on the bottom, we have bunions, hammer toes, and on the top, this is a serious condition that has an arch, a C-shaped arch, but then the bone is actually protruding below the foot. And so that increases, you can imagine, that would definitely increase the ship pressure in the foot in that area and can lead to ulcers and amputation, because every time you step on that, you're putting extra pressure on that area of your foot. So the next change that occurs, sorry, I did not put on my video. I forgot. I was such a excited. So as the next change that occur is actually in the skin. So persistent high blood sugar changes the temperature and the moisture mechanism in the skin, and it actually can lead to dry, cracked skin that can have can increase your risk of callus formation, ulcers, skin infections, and again, amputations. So everything you can see what I'm talking about actually has that endpoint if we do not prevent them from happening. Okay, so the fifth section of the changes that occur in the feet is actually an increase in the risk of infection. So this persistent high blood sugar actually impacts the immune system all over the body, but I'm talking about the feet right now. So the neutrophils are the police force, or rather the defense force of our immune system, and they're ineffective once that HbA1c is elevated. So they go to sleep, so they don't work to fight infections and actually heal that wound or deal with the infection. So it's important to keep that blood sugar under control so we can control in the event the person does get an infection. So we can see here from this review slide that the persistent high blood sugar affects a number of systems in the feet or all over the body, but definitely these areas here directly relate to the diabetic foot and what is resulting in either ulcers, amputations, and infections that do not heal. So what I want to spend most of my time on is looking at what persons can do to keep their feet healthy for life. What are the skills that persons, diabetics who may be on the call, or they may know somebody who's diabetic, what it is that you need to do. And the first one here, I've heard all 3 previous presenters talk about this one thing. The first thing is to make sure that your glucose is under control. Eating a healthy diet, regular exercise, taking your medication. Make sure that everything that you're doing decreases that HbA1c down to normal, below 7, below 6, as close to normal as possible. Decreasing that A1C or keeping it at normal actually decrease your risk of these complications developing. So it can delay them significantly or prevent them from occurring at all. So that is the goal of getting your blood sugar under control. And I think the sleep really is really underestimated because a lot of persons don't think of that as a direct impact. Number 2 is do not smoke. The immediate speaker before me just mentioned this as well. Do not smoke. Smoking is very bad for the entire body, especially the feet, because the feet is actually the furthest away from the heart. And so the blood flow down to the feet oftentimes is compromised just by the distance. So especially if you have peripheral arterial disease, but smoking definitely decreases that blood flow to the feet as well. So do not start. If you are smoking, work towards quitting. Number 3 is to avoid injury to the feet. And there are so many ways that persons can get injury to the feet, but the number 1 cause of injury to the feet, and this listen good, because this could be the trivia question, is wearing ill-fitting shoes or shoes that are either too small or they don't fit properly. So wearing shoes that do not fit properly is the number 1 cause of injury to the feet. We want to say to persons to avoid injury, never walk barefoot. Never walk barefoot, not in the house or outside of the house, because there's always a chance that you can get stuck with a nail or a tack or something that can cause an injury to the foot. And a lot of diabetics may not have good feeling in their feet. So when they got stuck, they may not recognize it. And so it goes on to get infected, and they may not see it for another couple days. And then we have a problem there. So avoid extreme temperatures on the feet. Do not soak the feet, especially in hot water, which is something we love to do, but we don't recommend doing that. That is very dangerous. Persons have gotten burned. They have major problems because of this, and we don't recommend that at all. Check inside your shoes before putting them on. There may be a pebble or something may have dropped in the shoe that could injure the foot. So just shake the shoe out and check it before you put it on. This last statement here says no bathroom surgery. And I'm sure everybody knows exactly what this is. Sometimes persons may have a little bump or a little ingrown toenail beginning or something on their feet. And because of that, they will start to pull out the alcohol and whatever nail clippers and nail file and knife and scissors, all kind of things persons use to take care of their feet. But we recommend for diabetics that you do not do that. Seek professional help right away rather than doing that, because you could infect yourself, you can make the situation worse, or you can delay treatment and all of these things. So we don't recommend that. We recommend that you come in and have your feet examined by the podiatrist as soon as possible, rather than trying to handle it at home. So number 4, okay, of these 7 steps that we were talking about how to take care of your feet and keep them healthy for life, number 4 is to wear proper footwear. Remember I said the number 1 cause for injury is ill-fitting shoes. So this is very important. Have your feet measured at least once per year, or at least once you go to a store, or you can come by our office and get your feet measured. That is important, because over time we feel as adults our feet don't change in size, but they do. You know, we have ladies who are pregnant, you put on weight, you lose weight, all these things impact the size and shape of your feet. And so you should have them measured. And then buy your shoes in the afternoon rather than in the morning, because just generally, because you are standing all day or something like that, the foot will have gotten a little bit swollen, may have gotten a little bit wider. And so we recommend you buy the shoes in the afternoon rather than in the morning, because it may be a little tight if you buy it in the morning. Always wear sensible shoes. For diabetics, we do not recommend the thong slippers or the flip-flops that goes between the toes. And the reason for this is because a lot of persons with diabetes don't feel well. And because they do not feel well, they may miss that in between that toe, that thong slipper is actually rubbing and causing a blister or causing an injury or wound to that area. And then of course it's between the toes. So if you're not looking at your feet regularly, you may miss it, and then it gets a chance to get infected and cause problems down the road. So number 3 is to wear the right type of shoes for the right activity. So none of us would go walking for exercise in a high heel shoe. Okay, so we will know that persons would wear the correct shoe. You would wear a sneaker, okay, and so that is what we're trying to get across. Persons where you may wear the wrong shoe for the right activity, and so no, you want to do that. That will definitely cause injury to your feet. Number 4 is foot care. This is what you do for your feet every day, okay? Practice good foot hygiene. And most persons do that. Wash their feet with soap and warm water. Inspect your feet every day. Wash between the toes. Dry them properly, okay? Before stepping into a bath, you will test the water temperature with your elbow, not with the fingertips, because the same neuropathy that you have in the feet, you may have in the hand. And so the temperature sensation, remember we talked about that earlier, may not be as good. And so you may miss that as well. So we say check it with the elbow, the inner side of the elbow, just bend the hand and put it in the water. That's a very sensitive area, okay? Wear cotton socks. We recommend actually diabetic socks. I'm sure a lot of persons, especially older diabetics, if they wear a sock that is a little tight around the edge, they'll have that line on their feet or their mid-calf where the sock is a little bit too tight. So the diabetic socks tend to have a looser border at the top. So we tend to recommend that instead, because the tighter the sock is, it cuts off the flow of blood down to the feet. It's okay to apply lotion and cream to your feet on the top and the bottom, just not in between the toes. The in between the toes are already accommodated. It has its own moisture. Doesn't usually get dry unless there's a fungus or something going on. Cut the nails straight across. Do not shape it into the pointy mouth that a lot of the young people are wearing now. Cut it straight across and file it with an emery board. If you are unable to do it, so for example, if you have a vision problem, you don't see well, you have arthritis, you can't handle a nipper, or you may have vision problem, you may have arthritis, you may have sensation problem, you don't feel well, then with those situations, you definitely should not be cutting your own toenails. You should ask a friend, a relative, or you can actually come to our offices and we'll be happy to do that for you. Number 6 is to do a foot self-exam. We just came out of breast cancer month and we talked a lot about breast self-exams. So this is very similar, okay? Except this one, we like you to do it every day. 60 seconds, that's all it takes. 1 minute for you to look at your feet, feel your feet, do it every single day as a diabetic. It can actually save your life. So we want to make sure that persons are able to do this. We actually teach classes on how to do it, what to look for, where to look, all of that good stuff. So we recommend this for you to do it every day, and it only takes 1 minute to do it. Number 7, and the last one is to get help. If you need help, get help. Okay, the first thing is that all diabetics should see a podiatrist, have their feet examined at least once per year. Now, some persons will have to have that exam or be seen by a podiatrist more often, simply because they may have concerns, they may have ulcers, they may have ingrown toenails, they may have deformities, they may have other things going on. And because of that, we would have to see them more often. This is important because research has shown that seeing a podiatrist actually saves lives, and saves money. So we want to make sure that persons have their feet for life. And one way to do that is to see a podiatrist. See, we also recommend that person see a podiatrist as soon as possible when there's a problem. For example, I may see a patient, and they have their feet are perfectly fine, but another week, a month, several months later, they develop an injury or may develop an ingrown toenail or something like that. It's best to come back in rather than waiting for the year that was initially assigned or whatever time it was. And I know persons would do that. So we can be seen as a podiatrist. We have private offices. We actually have a podiatrist in the public sector now at Flamingo Gardens and Elizabeth Estates Clinic. So persons can actually go to either one of those clinics and see the podiatrist just by registering, especially our senior citizens. That would be absolutely free. For persons who are under the age of 65, they may pay a registration fee. So those services are available in our private offices. It's just a call. You can make an appointment. It's good when your primary care doctor refers you because it's part of your care plan. As your diabetes management, you should have your feet examined, just like the other speakers talked about. Your eyes, your teeth, your feet, all of these things should be done as a part of your diabetes management. And so we definitely recommend that. And once you're seen in our offices, once you tell us your primary care doctor, we will send them a note that you were seen and what we found and how often you should come. So that is what I recommend for 7 steps to make sure that you keep your feet healthy for life. One is the glucose control. Do not smoke. Prevent an injury to your feet. Wear proper footwear. Provide proper foot care. Do a foot self-examination every single day and get the help that you need so that you can make sure that your feet are taken care of and they are in good condition. I love this picture because it has all healthy feet from all ages, from the baby, teenagers, older persons, adult, and this is what we're striving for. As a diabetic, you don't have to lose your feet. You don't have to get an amputation. You do not have to get an ulcer. You can have your feet healthy for life. And one of those ways is to make sure you see a podiatrist at least once per year so that we can help you take care of your feet. Thank you so much for your attention. And these are my contacts. You can actually contact me at any of those numbers. My WhatsApp is 802-FOOT. So you can actually text me on that number and you can get an answer. So thank you so much for your attention. I appreciate the invitation and this opportunity to speak to persons about diabetes and their feet. Thank you.
Thank you very much, Dr. Monique Mitchell, the podiatrist. And
Yes,
now for
sir.
our trivia, I'm going to give you an easy one this evening, very easy. And that question was reiterated a couple of times by our podiatrist. It is the #1 cause of injury to feet. And anyone can raise, that's Veronica Pearson. Okay, go ahead.
And the answer is improper fitting shoes.
All right, okay, we have a winner. All right, and again, you can collect your prize.
Thank you.
From the Logos Bookstore at the Harbor Bay Shopping Center. Also, I want persons to contact us, to give us their phone numbers, all the prize winners. I'm going to put my cell phone in the chat, but it's 455-5551. I'm going to put it in the chat so we asking that all can call us to give us your name and your phone number. Okay. And now we're going to have a very interactive session. And our next presenter is going to talk to us about food and meal preparation. And coming to introduce her will be yours truly. Our next presenter is she has a health coach at EFIT Bahamas. She lives on the island of Grand Bahama. She earned her culinary degree from the Hotel Training College. She's also a health coach. She also has a health coaching certification form from Precision Nutrition. Her goals are to motivate, to inform, to support Bahamians with their meal planning, and to help incorporate some daily exercise into their schedule. She used her culinary and coaching abilities to create healthy, familiar meals by building kitchen confidence without sacrificing flavor. Ladies and gentlemen, without further ado, I welcome you to Miss Dr. Katina Says Lockhart.
Doctor,
Not sure if you can hear me. Can you hear me?
I can hear you.
Yes, you've been promoted to doctor.
Put that on mute.
Can you hear me?
Yes, ma'am, we can hear you.
Yes, we can.
Great. Hi, welcome. My name is Katina Sears, and I'm here to show you how you can meal prep. So what I do is work along with your physician's recommendations and try to help you incorporate things that you already like to eat. So today I'm going to quickly prepare salmon, salad, and some stir-fried vegetables. So first off, we have some washed salmon. I'm going to season it now for you. Just a little bit of lemon. And so, of course, you would all know that salmon is good and high in omega-3. So what I have is a little bit of mayo here. I know it seems strange, but what I do is it's just a teaspoon of mayo. So I brush the parchment paper, and this is baking paper. You can purchase this at any food store. And so you just put a little down, and then you're going to put some on the salmon. This helps the seasoning adhere to the salmon. The mayonnaise is made basically of oil and eggs. And so this will help the seasoning stick to the salmon. And then when we broil the salmon, it will baste the salmon. So it melts slower than, I would say, butter, and it stays in place. Similar amount of calories though. And so that's the base. So I tend to use Himalayan sea salt. It has less sodium than regular salt. And so those who may be plagued with high blood pressure, hypertension, or any kind of chronic illness, I do recommend that the Himalayan sea salt or any sea salt is better than just iodized sea salt, unless you need iodine. And so this is just about 1/4 of a teaspoon. Don't put too much salt on it. Fresh black pepper. For those who like spice, I put a little bit of red pepper flake. Those who want fresh garlic, they tend to stay away from the processed garlic, the garlic powder, and stay away from those things. I use fresh. And I don't know if those who may not know, fresh garlic actually lowers your blood pressure as well. I have a little bit of parsley. Oh, this is the chive, sorry. This is the parsley. And this is some lemon zest. So what I did was take the peel of the lemon and I just diced it finely, and this gives intense flavor. So I am gonna do it for both sides. Because I know sometimes you see on TV that they only season one side of the meat. I season both. Do it again on the next side. Some more lemon. This time I'll just do the salt, pepper, no more salt and black pepper, no more hot pepper. Black pepper. And I'm gonna put it on a bed of sliced mushrooms. I have a mix of button mushrooms and cremini mushrooms. So what the salmon will do when it's boiling in the oven, it's gonna marinate the mushrooms. The mushrooms are like sponges. They absorb all of the flavor. And so I want to put this down as a base. Get it off. I'm gonna put the salmon on it. And this is a 3 to 4 ounce serving of salmon. I know it may look big, but it's very thin. And that's what you should have. You should try to control your portions every which way. So the amount of oil that you eat, the amount of protein that you consume, you should try and keep it under control. Some people recommend that you eat 3 times a day. I eat anywhere from 3 to 5 times a day, small meals to keep my blood sugar levels consistent. Okay, so next up. So we're gonna put that on the side, let them marinate for 5 to 10 minutes, and then we'll put it in the broiler for 10 minutes. Be fully cooked there. So next up, we're gonna have a salad. So I know it's important with people with blood sugar issues to stay away from a lot of high sweet foods. So my research, I realized that blueberries are the best fruit for you to have. And so what I have is 1/4 cup of blueberries. So half will go for the vinaigrette and the other half will go in the actual salad. So these have already been washed. So I just want to put a few in and I'm gonna mash these. And so this is gonna sweeten the vinaigrette because, you know, my people, my Bahamian people and people throughout the Caribbean, they tend to have a sweeter taste palette. So this will give flavor to the salad. And so once you've mashed blueberries sufficiently, it's gonna take a little time, a little elbow work, get some exercise and some activity. A typical vinaigrette consists of mustard, oil, and vinegar, and then sometimes a sweet, salt and pepper, and any herbs you want to add. So now that I've mashed it and it's basically a consistency that I want, I'm gonna add some red wine vinegar. You like, you could have apple cider, balsamic, whatever you like. And I want to measure everything. Free hands cause those extra calories, extra sugar into your meals. And so this is only for 1 serving. And so I want about 1/2 teaspoon of vinegar. I don't want it to be too sharp. Same amount of olive oil, 1/2 teaspoon. And you just want it to be able to coat the leaves of lettuce. I want to season this. Black pepper, fresh black pepper. And salt. Okay, so I have some other items for salad. I have some shredded carrots. I also have some red onion. And then my salad is here already washed, my spring mix salad. And so it's that's some deep greens, some radicchio, some spinach, and it's already been washed and dried, spin dried. So I'm gonna incorporate everything in the bowl. It's just about a cup. There you go. That's about a cup of lettuce. Oops. Some red onion. And these add-ins could be whatever you like. I suggest to be careful with tomatoes because tomatoes are actually a fruit and they're high in sugar. And so you would want to toss your salad in your vinaigrette. You don't want to pour your salad dressing at the table. You want to toss your salad to make sure everything is coated, and then you don't use as much. I'm tossing everything. And also you could check for seasoning. So you would want to taste this to make sure you have enough salt, enough pepper, enough black pepper. If you want to add some fresh garlic, you can if you like raw garlic. Some people don't like the taste and flavor of raw garlic. You could put some lemons in it. You can put any seasoning that you may want. Okay. So the salad is fully dressed and we'll just set that on the side. And the blueberries will top it when I'm plating. So also I wanted to show you, this is a pomegranate. This was provided to me by one of my friends from Juju's garden here in Grand Bahama. And so I try to use fresh and local produce as much as possible. These are organic. And some people, has a little more sugar than the blueberries, but I want to show you how to get the juice out of a pomegranate. So you take it and you roll it like an orange or a lemon, and you're crushing the tiny seeds inside. And I just want to show you how to get the juice out of it. And so you roll it and you'll feel it in there under the palm of your hands. You'll feel the liquid inside. You'll actually hear the seeds crushing as you roll it. Okay, and so I rolled it a good bit. So now you want to puncture this, and I've already washed this fruit. So you want to puncture it. I don't know if you saw the juice that came out. And so you don't want to add this directly to anything. You also want to measure this too. So you have a container and you squeeze the pomegranate to get the juice out. Okay. And so that's fresh pomegranate juice. This way you know that there's no added sugar. It's fresh from the fruit, and you also get to consume the meat as well, the fruit. So next up will be sauteed vegetables. Cut them both on the side and get out. So we have a non-stick pot. We have it with a lid. And so this is my trick for sauteing vegetables, the low calorie. So in this pot, I'm gonna do some broccoli, some asparagus spears, and some yellow squash. Now all of these cook at a different rate. Depending on the doneness, how you want your broccoli. I want it crunchy. Some people want it more on the soft side. So you cook this to your taste. So my trick here is on a medium-high heat. I put an ice cube in. An ice cube is basically about an ounce of water. And so of course my broccoli has already been washed. I add my broccoli and I cover it. And so the broccoli will steam, the ice will melt. So you still have the cold and the hot going on, and you have a combination of steam that steams the broccoli nicely. After the broccoli has steamed sufficiently, then I'll add the asparagus because I want that nice and crunchy as well. Those that want the asparagus cooked longer, they would put it in at the same time as the broccoli. And of course, the yellow squash will be the last thing added because I want it to stay nice and firm. So at this time now, I'm going to put my salmon in the oven. So I'm putting it on the bottom shelf on broil. And that's the salmon with the mushrooms. And it cooks for about 10 minutes. So just waiting for the ice cubes to melt and waiting for the steam to happen. So you can see it. Started yet? Oh, I got a problem with it. Can you hold one moment for me, please? That's how you know we're cooking live. Sorry about the technical difficulty.
Broccoli would just be nice and crunchy the way I like it anyway.
I'm sure it would. Anybody have any questions this time while I get this remedy? I'll have to go to my regular burner. Unfortunately, this is something that I can't change my camera to. I'll just put it on my regular burner so you can see while I manipulate this.
The idea of putting the cubes in, I've never thought about that. Just putting the cubes, 2 ice cubes, and then when it's melted, the broccoli is steamed. That's genius.
Well, there's a lot of tips and techniques, and that's what I
like that. I like that idea.
Show my clients. Let's get this.
Was your salmon skinned?
Yes, it was. It was
Okay.
a boneless, skinless salmon fillet.
Okay,
You can use any type of fish. The protein of choice I use is fish, salmon or grouper, of course, is now in season as of December, out of season, sorry, as of December 1st. So you can't use grouper. So you can use mutton snapper. Those who are on the islands, they can use turbot or any other kind of fish. And so it's coming up to the cubes. The ice is now melted and the broccoli is turning green.
Okay.
So I'll let it steam a little longer and then I'll add the asparagus. Zucchini will be the last thing to add. You can also add some seasoning after it starts to steam. If you put it on in its raw state, the salt will just bounce off into the pot. You want it to soften a little and absorb some of the moisture so the seasonings would stick to it.
I had a question.
Yes, go ahead.
I'm not sure if I missed something, but the mayonnaise on the salmon, is that in place of, I know some persons brush with olive oil. You didn't brush with any oil, did you?
No, I did not. The only oil I used in this entire recipe would be for the salad dressing.
Okay.
Right. Because I measured out a teaspoon of mayonnaise, but I only used maybe a quarter of the teaspoon.
Okay, great.
Okay, so the broccoli is nice and steamed
Is that mayonnaise also to seal it?
It's to seal the seasonings on it. Yes, it is.
Okay, okay.
And of course, I'm cooking this on a medium-high heat. And it's a non-stick pot, non-GMO.
Okay.
And I'll let that steam for another minute. Then I'll add this yellow squash, and then you can season it, and I'll show you the different ways that you can season your vegetables to add flavor without adding too much sugar.
The pomegranate.
Yes, go ahead.
The pomegranate, you roll it and then you squeeze it. It doesn't give that much liquid, I guess.
No, it doesn't. No, it doesn't.
So now it makes sense why a bottle of pomegranate juice is so expensive.
Correct. Okay, so I just add the yellow squash, and I'm gonna let that cook for just another minute. Now I'll bring it back to the area and I'll show you the different ways and the different things that you can use to season it. Right now, it's just the fresh vegetables and the ice. There's no salt, there's no pepper, no other aromatics. Just waiting for it to steam a little. Okay, that's about a minute. Any other questions?
It's a shame I can't taste that salmon when you finish with it.
Okay, so I don't know if you notice a little bit of char on the vegetables, which is good. All that is the equivalent of flavor. They call it the Maillard reaction when anything browns. So I'll put a little Himalayan sea salt. And it's a very mild seasoning. Black pepper. Okay, so you have your choice of seasonings right now. You can add fresh garlic. You can add red pepper flake. You can add fresh lemons. You can add vinegar. It's your choice. I also made this. This is a puree of fresh herbs. And so this is parsley, basil, chives, and marjoram. But you can use any four that you like. If you use tarragon or rosemary, I suggest just using about a tablespoon of each one of those. But I use a quarter of a cup of each one, parsley, basil, and chives. And then about a tablespoon of the stronger ones, which is rosemary or tarragon. This is also blended with a half a teaspoon of olive oil and a tablespoon of vinegar. And what this is meant to do is accentuate the flavor of any type of protein or vegetable dish. And so I try to add flavor where I can to make the dish as appealing as possible. And so this is another flavor enhancer that I would put on vegetables to just give it some pop or some pep. And so today, let's put some fresh garlic in the vegetables. And let's use a little lemon. That's a pit. And so you want to give it another stir and put it back on the heat and turn it off. Okay, so your vegetables, the residual heat or the carryover heat will continue cooking the vegetables. And so now we are almost ready to assemble the entire meal. Let me just clean up the area. Any other questions at this time?
When are you gonna put on the 4-herb mixture you made?
I'm gonna put it on the salmon.
Oh, it's going on the salmon, okay.
So let's check on the salmon. Salmon is boiled beautifully. You can see the paper was burnt a little, but this is baking paper. That's expected. It's been on broil, and the salmon, it's well done. It's fully well done, and it's not been that long. So this just to show you how fast you could prepare a meal. It's almost fast food. Okay, so let's get our plate, and let's take it. So we have our salad that's been tossed in the vinaigrette, and you notice that it's collapsed a little, and it's collapsed because of the vinegar, but it's still gonna be very, very good. And don't forget, we're gonna top it with the fresh blueberries. Salmon. And you notice it did not stick. The mushrooms have softened as well in the broiler, so they go on top. There are those who love their mushrooms. And these mushrooms have absorbed all of the flavor from the salmon. Notice there's hardly any juice left in the pan, and they've gone into the mushrooms. The mushrooms are like a sponge, they soak up everything. I have a little chive here. So I love chives on fish. And it's just a personal taste. You don't have to put the chives on. I'll put blueberries on. And then the vegetables, the fresh vegetables, will be the last thing. Blueberries. And I do have the recipes available for you. Like I said, just one more. Finally, the steamed vegetables. And so this will be a great lunch to carry to work or to have a dinner anytime you want something special for yourself. I'll sit down and have this with a glass of sparkling water. Treat myself to something good. And finally, this is they call it a chimichurri. This is the chimichurri I was telling you about. And I just put a bit on the top. Like you see, you can blend it to whatever thickness you would like. Wonderful. Okay. And so there is my fresh salmon, broiled, my steamed vegetables, and my blueberry vinaigrette salad. You can easily interchange the pomegranate with the blueberries. Thank you so much. And up on my link at Instagram, or you could go ahead and ask now. Thank you.
Looks fantastic.
Excellent. Miss Katina Sass. Miss Sass, I'm going to let you go ahead and present your trivia. How do you propose to do that?
Okay, I'm located in Grand Bahama. I see most of the trivia is for Nassau. Let's do something for Freeport. And so I told them that the Rotarians that I would donate this meal to a person who could answer questions. So let's see. So the question would be, what is the name of this sauce that I mentioned? First one to put it in the chat. In Grand Bahama, I will deliver this plated meal to you.
Chimichanga. Chimichurri.
Have you participated before? If you have, it'll just be going to someone else.
Yes, she has won before, yes.
This is Sharice. I was going to say the same thing, chimichurri.
That is correct, Miss Brown, and you have won the meal.
Oh, thank you, thank you. I did you.
So you just leave me your details of where you're located, and I will deliver this to you today.
Awesome.
Thank you so much.
Wonderful.
Katina, sorry, before you go,
Yeah.
I see everyone is asking if you can give a close-up of the meal.
Okay, no problem.
Scrumptious. Scrumptious and healthy.
Yeah, that looks really good.
And it's done very quickly. Thank you so much.
I need to hire you to cook for me.
Good job, Mrs. Says.
Hey, please share some pictures when it's delivered, please, Katina.
Will do.
Hey, good afternoon, everyone. I am filling in for Rotarian Owen, who is our MC for the evening. Just before we get into our next presenter, I have to let you know that Katina was true to her word, and she has presented Ms. Sharice Brown with her lunch. So we actually have a photo. There we go. The meal nicely prepared by Katina, and Sharice looks like she's about to really enjoy that. All right, so thank you so much again for that, Katina, and I'm sure that it is a scrumptious meal. Okay, all right, so moving right on with the webinar, Ms. Shirley Smith will be bringing remarks from the Bahamas Diabetic Research. Ms. Smith, you are free to go ahead and give your remarks, please.
Good morning, or good afternoon, sorry.
Yes.
My name is Nurse Shirley Smith, and I am the coordinator, the program coordinator here at the Diabetic Research Institute. And I thank you so very much for the opportunity to come and give you some information on the Diabetic Research Institute, because we're always looking for ways to reach out to persons to let them know that we are here and what is available for you. So the Diabetic Research Institute is a nonprofit organization which was established in the year 2004. And our aim here is to educate and support persons with type 1 and type 2 diabetes so that we can empower them to live healthier and better quality lives. Some of the services that we have here, we provide screening, we provide counseling for persons, because you know, nowadays along with COVID and everything, persons especially who are just being diagnosed with diabetes, you know, some persons feels as though it's a death sentence, but we are here to let them know that it's not a death sentence, so they can come in for counseling, and our psychologists here will help them with coping skills on diabetes. And then we also have services where we have a 9-week program where persons can come in and learn about diabetes, how to manage it. And we teach on topics like meal planning, medications, complications. We also have specialists come in, like Dr. Mitchell, who I saw, who was on early on the program. They come in and they help people to understand some of these complications and how these complications can be prevented. And we also, one of our specialties here is we work with the type 1 diabetics, and you know, that's usually the children. So you can imagine some of the problems that they have sometimes. So what we do is we have what we call a type 1 warrior program, where our diabetics, they come in once a month and they learn about ways of managing their diabetes better. And at these, we also provide, we have a chef come in, teach them how to prepare simple but nutritious meals. We teach them about carb counting. We teach them about, again, our psychologist is here, and he talked to them about not feeling alone with diabetes. So these are some of the programs that we offer here. And we get referrals from various ways. Princess Margaret Hospital, they refer persons here. Various private doctor offices, the Family Islands, they all refer persons here. And sometimes persons are just walking by and they see our sign and they come and they ask for services. And then friends of persons who were clients here. So we have referrals in different ways. And then since the COVID, you know, a lot of persons were not receiving that face-to-face care. So what we do is we offer Zoom service, and we also reach out to the Family Island clientele. So they come in via Zoom and we teach them how to manage their diabetes. And the 9-week program that I talk about, that is also now offered via Zoom. So we always look for opportunities to reach out to people. And before COVID, you know, we went into schools when they had their health screenings. We went in, we offered our services there. If any person's having any health clinics, we come in and we offer our services there. So we like to do outreach, but of course, COVID came and stopped all of that. Now, where are we located? We are located on Montrose Avenue, the Multi-Discount Party Center. We are directly upstairs there. Our telephone number is 326-5134. You can reach us there. So if you think that you need an appointment, you can call us and we can set you up by appointment. And everything is via appointment these days because of COVID. You know, we don't accept walk-ins at this time. And then you can also email us at info@diabeticresearchinstitute.com, because you can go on our website, which is www.diabeticresearchinstitute.com. And there is an app that you can get a clinic appointment like that. So, and then we'll definitely respond back to you. So I just wanted to give you some information on the Diabetic Research Institute, and all of our services are free of charge. So there's no charges for our services. So you are welcome. If you're a diabetic, if you're a family member of a diabetic, you can stop by and we can help you as best we can in helping you managing that diabetes. So thank you once again, Rotarians, for giving us this invite. And I hope that you continue to have a successful webinar. Thank you.
Thank you. Thank you so much for those remarks. I just want to get that information from you again so I can put it in the chat. So you're saying the phone number is 326-5134?
Correct. That's the phone number.
Okay, and the email is info@diabeticresearchinstitute.com?
Right, correct.
Okay, and what is the web again, sorry?
The web page is www.diabeticresearchinstitute.com.
Okay, all right.
And we have all of the information that you would ever need. You know, we just upgraded our website, so you can go on and you can find wonderful information there.
Okay, excellent. Thank you so very much again. I appreciate that you took the time out to come and bring us remarks today. Okay.
Thank you so very much and good afternoon.
Good afternoon. Okay. So moving right along in our program, we have a heartwarming story coming from our next presenter. Now, unfortunately, I don't think our MC is back yet, so I'm not sure who we had lined up to introduce our speaker. So Rotary, if you could let me know who will be introducing Ms. Melvern Davis, please.
Okay, Mrs. Melvern A. Davis is born to the proud parents of Robert and Haiti Johnson. She is the number 10 of 11 children, 10 girls and 1 boy. She attended our primary years at Southern Junior Primary and secondary and tertiary at St. John's College, Bahamas Teaching College, and College of St. Benedict in Minnesota. Graduating with honors, she is presently a licensed Justice of the Peace in the Commonwealth of the Bahamas. She is married to Leroy Davis, and she is the mother of 2 lovely children, D'Amico Davis and Dana Davis Mott. She is a proud grandmother to 5 grandchildren, 4 girls and 1 boy. Ladies and gentlemen, I present to you Mrs. Melvern A. Davis.
Thank you so much. And it's a pleasure being here this afternoon in this forum. I enjoyed the earlier speakers so much. I was just sitting down waiting to hear more. But today I'm supposed to be talking about myself, my life as a diabetic living with diabetes. In 1985, March, I started having some severe symptoms. I was losing weight drastically. I was drinking anything in sight. I went to Andros and I drank almost a case of Vitamals in 1 week, plus soda. And Vitamals I never even bothered to drink, plus sodas. And as I continued to drop the weight, I kept saying something wrong with me, but still not going to the doctor. So after a while, I said, boy, I went to a church convention in March. And while I was on stage, I felt so dizzy and felt like I was just going to collapse. And I had a candy in my hand and I ate the candy. After eating the candy, I started to feel better. So I said, wait, something definitely wrong. But I kept eating candies after that. Every time this feeling came on me. And afterwards, while I was driving, my eyes became blurry. And when I started to read, I had blurred vision, but still not going to the doctor, trying to see what was really happening and try to diagnose myself. So after the trip to Andros in July, and my friends look at me and say, girl, why are you losing so much weight? Say, you could pour water in your shoulders and pour water down. And I say, well, I don't know. I must be just losing weight. Now, you see, if cancer and stuff was prevalent at that time, I guess they would say, oh, I had AIDS or I had cancer, but still not paying much attention to my body. So after I stayed in Andros for a week and I came back home, and during August Monday of that year, my sisters came to visit me and they say, you better go to the doctor. Something is definitely wrong with you. And after drinking, couldn't quench my thirst, going to the bathroom every time I drink something, I had to urine, had itching in my hands, itching all over my body. I said, okay, I'll go to the doctor. So the next day, which was 1985, August, I went to my doctor at that time, Dr. Kalma. So when I walked in his office, I gave him my symptoms and he sat me in his office. He said, open your mouth, let me smell your breath. So I was looking at him and I say, this man must be crazy. He asked me to smell my breath. And when I opened my mouth and he smelled my breath, he said, boy, yes. He said, if it is what I think it is, I'm gonna have to admit you to the hospital. I say, for what? So he said, it could be diabetes. So I say, diabetes? What is diabetes? He say, any of your family have diabetes? I say, I know my mother, she didn't have diabetes. My daddy, I never heard them talk about diabetes. I say, but I remember my daddy said his sister, which was my aunt, she was diabetic. So he said, okay, it could be hereditary. So he say, but I'm gonna run some tests. After the tests, if it's what I think, I'm gonna have to admit you to hospital. So I say, but doc, why? I just had my last child was only a year because she was born in 84. The diabetes did not show up during my pregnancy. My husband was away in school, but he flight school, and he used to come home every Friday for the weekend. So anyway, I said, all right, doc. He said, are you driving? I don't want you to be driving home. I said, but I'm driving. But I had to push my head right up to the windshield in order to see where I was going. So he said, but you don't need to be driving. I said, but I don't have anyone else to drive. I'm going to drive. And anyway, he said, okay, I'll call you. And I drove by my mother's house. When I reached by my mother's house, I told her what the doctor said. And she said, well, I know your auntie had diabetes, but all you need to drink is some bush. You don't need to go in any hospital. I say, no, I have to go to the hospital, but I have to go back to the doctor when he calls me so that I can confirm that it is diabetes. And we talk and we chat and we talk. And I went home that evening, and actually my appointment was that Friday. This was the Tuesday when I went to him. And which was Wednesday, my phone rang, and it was his office. And he said, you need to come in right away. So I went into his office. When I reached there, his nurse, we were friends, he said, girl, Dr. Kummer said, we should have stopped you you came here on Monday, say, you are really sick. So I say, what? So she said, anyway, let him tell you. And he called me in his office. He sat me down and he explained to me what was happening. And my blood sugars was like 600. And he said he doesn't know how I was functioning at the blood level so high. I said, but I trust God, and I know it must be God, because I was not destined to go at that time. And he told me, say, now you have to be admitted to hospital immediately. He said, when you go to the hospital, I don't even want you to go to the business office or whatever. I want you to go straight to the ward, and whoever take you to the hospital will go to the business office and pay. So I said, but I have a young baby at home. So he said, somebody will have to take care of that. You have to take care of you. I said, okay, doc. He said, but you don't need, I said, but I have to drive home. I don't have anyone else to drive me home. So I drove by my mother's house again and told her the bad news. And she again saying, but the bush and the stuff. So I said, no. And God had it. So at the same moment as we were talking, I saw the car pull up in her yard. It was my husband. And I told him, explained to him what was happening. And he said, okay, let's go home and pack your bags and we'll go to the hospital. So we did that. And I did as Dr. Kummer told me. I went straight to the ward. They were waiting for me. And when I got up there, they talked to me a little while and they put me right in the room. And right away, they put the drips up on me. I guess they were giving me insulin. And then they put the drips up. I still didn't know what was diabetes or anything about diabetes. And the nurses would come in and they would explain to me and they would talk to me. And they had me like on a diet, only eating certain things and just with this insulin all day, just giving me these needles. So after a couple of days in hospital and with the treatment, I started to feel a little bit better. And actually the weight was still off, but I started to feel a little better. I wasn't having as much thirst as I had previously had. And my vision started to become more, I was able to see more visible. So as time went on, a week I stayed in there and they kept giving me these treatments. And after the second week, they brought me this orange And I said, what is this for? So they brought a syringe and they said, you will have to try and practice on this orange because you would have to be going on insulin. So I said, what is insulin? I don't know. And they explained everything to me about insulin and the orange. I tried to inject the syringe into the orange. And when I learned to do that, after 2 weeks and a few days, they allowed me to go home and told me that with training, with education and doctors' visits, and I would be better and I would be able to be more controlled. So I told him, he asked me if I used to, they always ask me, you used to eat a lot of sweet, you used to eat a lot of carbs. I said, not really. I remember eating about whole nut chocolates every day and butter pecan ice cream. They were my favorites. Carbs and stuff, not too much. But then I guess because of hereditary, I was the 10th of 11 children to get the diabetes. So I was on insulin for 36 years. From the first time that I was diagnosed, I had been on insulin. And I was kind of up and down. Most of the time I had low blood sugars, which is hypoglycemia. And it used to come to me like early in the morning, like around 5, 6 o'clock in the morning. My husband told me I used to be like shaking or, pulling on things and just out of it. And thank God he was there. And he would just get up and give me the juice and the sweetened drink. And I came back normal. And then my children, they all had to be educated over the years on the disease. They did a lot of research. And then when the hyperglycemic came, which was more hypo than hyper, but they tried to help me with the control of the insulin intake and stuff. Right now, I am on 4 needles a day, but not because of the severity of the diabetes, but my doctor has it, stretched out in intervals. Whereas if I'm low or just getting low, I don't have, if I'm low, I don't have to take the insulin. So I can monitor. Right now, I'm able to monitor myself. I know when to take the insulin or when not to take the insulin. And thank God, over 36 years, I was only admitted to hospital twice since I was first diagnosed in 1985. And I think that's a blessing. Notice that of amputations and because people always ask me, so you don't look like no diabetic? I say, but how do you look when you're diabetic? I say, but I'm supposed to be looking drabby and droop and stuff. So they say, but you're well. I say, I am well. I didn't have any complications, thank God, no kidney problems. I check my doctor regularly. These are reading glasses. I don't have to wear glasses. And I am well. And I used to test my sugars quite a bit with a glucometer, but that was getting to me because sticking your fingers plus sticking your other parts of your body to inject the insulin and sticking your fingers all the time to check your sugars, I say, wait a minute, there must be something you can use instead of just sticking all your fingers all the time. And my son, he lives in Florida, and he told me, he said, there is something you can get, but you need a prescription for it. So I said, well, what is it? So he talked about this Dexcom, and he talked about a Freestyle Libre. And he explained to me, and I did some research on the Freestyle Libre. And I said, okay, I'm gonna try using the Freestyle Libre, which is a device where you don't have to stick your fingers. You use a sensor and to scan it. this is a sensor. And then this here is the patch on my skin. It has to be changed every 2 weeks. It's expensive, but it's worth it. You change this every 2 weeks, and you turn it on, and it tells you if you want to scan sensor to check your glucose levels, and then you scan it on the device, and then it gives you. Well, I just ate, so I'm a bit up, but that's not normal for me as a diabetic. But I check like that, and I don't have to stick myself all the time. And that's a plus for me, having not to be sticking all the time. I try to eat my meals on time. I was very, very not following rules before, because actually I don't like to eat. And they always just tell me, girl, you better go eat. It's time for you to eat. And sometimes I would start shaking, and then I say, okay, let me go eat. And people would always around me, my friends or whatever, they would know that I'm diabetic, and they would know when I'm going low or if I need some assistance. So I would try to eat my meals on time, take my medication on time. I'm not on any diabetic tablets, just the insulin, and which was also good for me too. I'm using now the insulin pen. Looks just like a regular pen. And the insulin is in this pen. And actually I'm on 2 types of Humalog, and I'm also on Lantus. So I have 2 pens, one with Humalog insulin and one with Lantus insulin, which I take in the night, the Lantus. And it's better because when you go out, you won't have to be embarrassed with taking this needle, this syringe out, turning this bottle upside down and pulling to get the insulin in the bottle to stick these big needles inside your hand. So, or wherever, where you put the insulin. This here, we use just small needles, a little needle like that. And it measures out, you turn the thing and measure out how much insulin you need. If I need 3 units, I turn it to 3 units, take the alcohol swab, wipe my skin with the alcohol swab, and just inject the insulin in. And this is very good for all diabetics because you can take this around with you. Nobody will know you're diabetic because you ain't have those big needles where you have to be pushing yourself all the time. And actually it has to be in a cool place. So you can also purchase a little small cooler bag, and you put some ice or whatever in it, and you rest the pen in there. If you're traveling or if you are going somewhere, which will take a little time getting there, and your insulin won't get bad. I think that's basically me as a diabetic. And let me see, I have a few more notes. Let me see if I left out anything. But I think I'm good, and I'm controlled, and insulin in small units, but I said earlier, and I am not on any restricted diet, which is good, but I don't eat too many carbs. I stay away from fried foods, French fries and stuff. No. Occasionally, if my grandchildren are eating some fries, I might taste 2 or 3. And they always say, but Grammy, you don't want. I say, no, I am disciplined. And so I try to eat properly because I do not want to go to any hospital. And I think keeping myself for 2 whole years without going into the hospital, that's a plus and a blessing for me. And exercise also is very important. So I try to exercise. If I don't get out to the park, I'm in the house and I move myself around up and down out of the chair or whatever, just to do a little exercise every day. And it's been a part of my life. So I have to pay attention, full attention to it. And I'm passionate and also demonstrating the ability to live with a chronic disease or chronic condition and do all the things that I want to do. So I have to take care of myself and be a good disciplinarian, a good person with disciplinarian skills, so that because I want to live. I don't want to die now and say, oh, she died from diabetes, her diabetes gone out of control. No, I am disciplined and I want to remain disciplined. And I have just a little one verse of something to say. Insulin pumps can talk to iPhone, continuous sensors can detect the ketones. If the technology is so advanced, why couldn't it make a better beta cell clone? And then it says, despite a diagnosis harsh and live and declare, I remain positively sure science will conquer the despair. And one day we will have a cure. Thank you very much.
Wow, thank you very, very much, Mrs. Melvern Davis. I mean, a personal story with so much information, knowledge, and excitement. And now for our trivia question. Please raise your virtual hands if you can give me at least one measure that Ms. Davis have took to live a healthy life with diabetes. One precaution, one measure that she have undertaken to live a healthy life with diabetes. Raise your hand, virtual hand. It's L. Raming.
Yes, she disciplined herself. She monitored her blood glucose.
Okay. All right, exactly. You are a winner. I'll add your name to the list. You can collect your prize at the Logos Bookstore on Tuesday. Okay.
Thank you.
Coming right now. You can also call me. My number is in the chat with your name and your number.
Okay.
All right. Coming now is our final presentation, and it's going to be an interactive session. So I hope you are prepared to get active. Is our next final guest speaker, and he will be introduced by yours truly. Our final presenter is a certified holistic health coach who currently serves as the head of health, promotions, and wellness at Bahamas Wellness Health System. Bahamas Wellness is one of the latest or the fastest growing healthcare companies in the Bahamas, now currently with 4 clinics within 4 years. He is most known for assisting patients with their lifestyle and diet adjustments. Many patients coached by this person eventually go to have their medications reduced or removed due to changes in the way patients eat, sleep, move, and manage stress. He believes that with the power of routine and a positive attitude, anyone can achieve their most important health goals. Ladies and gentlemen, fellow Rotarians and guests, I present to you Justice Brown.
Good afternoon. I hope everybody's good. I'm very happy to be here. Thanks for that introduction. You made that sound super good. So my name is Justice Brown. I work at Bahamas Wellness. Dr. Alton Lightborn would have been on earlier to give an opening speech. So at Bahamas Wellness, I've been there for about 6 years now. And at Bahamas Wellness, what we do most of all is we help patients get from a state of disease to a state of wellness. And we do that through using our Live Free Wellness program. So our clinic is pretty traditional in nature, where you come to a doctor, you get your lab test done, you get examined, you're seen by the physician, and based on your current health status, for example, let's say we have diabetes, let's say we have obesity, issues with high cholesterol, hypertension, whatever that may be, we treat you traditionally and in a standard way by putting individuals on medication where necessary, doing lab tests and highlighting where, for example, the previous speaker spoke about how our sugars were at 600, for example. So if a patient was to come in at sugars of 600, we'd let them know that, this is definitely not where they want to be. And we highlight a goal range for them where we want them to be. And that would be closer to the 100 range. And so from there on, then our program starts with our patients. And what this program is a mixture of the patients interacting with our nurses, our nutritionists, our health coach, and our physicians, all in the attempt to get them well. And what this may look like is changes in diet, changes in exercise strategy, change, and so on and so forth. Because science is all there. Diabetes, type 2 diabetes, is no longer and should no longer be considered the result of hereditary or genetics. So we are very certain that individuals that have diabetes is a result of their current lifestyle. And the pretty interesting thing is about genetics is that when you come from, so let's say I was born in a family of 3, right? I do inherit my mother's and father's genes, but I also inherit my mother's and father's lifestyle. Probably go to bed at the same time. We probably eat dinner at the same time. We probably eat the same meals. If they exercise a lot, then maybe I'll be into sports. But if they don't, then I probably won't be into sports. So I would have probably gone my whole life not exercising, not eating healthy. And then now at a certain age, based on my Bahamian lifestyle, after 30, 40 years of eating a certain way or not moving a certain way or going to bed at a certain time, now I have these health complications. And so what the science is showing now, yeah, it can seem like it's genetic, but it's really we're all doing the same things. And this is why we see across the Western world, so we could just take America as an example. They have like 300 to 400 million people, and 30% of those individuals have type 2 diabetes. 70% of those individuals are overweight or obese. And what we see in practice is that even individuals that aren't diabetic, if you're overweight and obese, it's very likely that you're probably pre-diabetic. And so I like to sum everything up together. Western world, especially America and the Bahamas, we know that our numbers are about 80% of individuals that are overweight and obese, that all of us have some type of pre-diabetes or glucose dysregulation. So in other words, my sugars aren't responding the way it's supposed to. After I eat, my sugars go way above range, right? And so knowing that, we see that we have a huge problem, and everybody is not genetically, maybe we all came from like one place, an atom or whatever, but we all know that we're not all genetically related. So what's the common factor? The common factor is actually shown to be lifestyle. The things we eat for breakfast, what we eat for lunch, what we eat for dinner, whether we exercise or not, the type of exercise we do, whether we sleep well or not, how we manage it and cope with stress and emotional issues. These tend to be the factors that control our blood pressures, our blood sugars. And what we notice is that when we adjust these, this can happen. We can see drastic improvements in patients' health overnight. So I had a similar patient to, I think Miss Davis just came out. I don't want to mess Melvin Davis, right? Yeah, so I don't want to mess anybody's name up. So I think she just came up and she spoke about when she went to her physician the first time and her sugars were at 600. He smelled her breath. What he was smelling for was like the scent of acetone. It's a symptom of one of the complications of diabetes, diabetic ketoacidosis. This happens when your body no longer is making enough insulin. Now, what is insulin? So insulin is a hormone. Your body uses insulin in order to help turn the sugar in your food energy, right? So whenever we eat, let's say, depending on our meal, we produce a certain amount of insulin. Some meals produce more insulin than others. Now, when our body is constantly producing so much insulin in response to food, based on the foods we eat, these foods are generally our high sugar foods. I think Ms. Davis mentioned how she's really into chocolates, which are carbs. She didn't do much starches, but chocolates, sugars. I think she said a lot of sweet juices, also sugars. And what happens is when we have long-term use of these things, every single time we eat, we send our insulin levels super high, right? And what happens now over time is your body doesn't respond to insulin as well. So in other words, it overdoes itself by producing so much insulin in response to the foods we eat. And now at a certain point, your insulin, I'll say it like this, the insulin mechanism in your body just breaks, right? For easy conceptualization. So essentially now individuals, your body is just not responding to your insulin anymore. And as a result, your body doesn't think it can turn food into energy. And then all these negative symptoms happen, and we get to that state where Miss Davis actually had to go in hospital. And this is very common when we leave our health and our lifestyle unchecked and uncontrolled until the very last minute. Luckily, Miss Davis was able to pull herself back with the help of her doctor and family and her own self-discipline and routine. And many individuals, because they're not, they may not have that personal experience, many individuals never get there. They never get to the point where they can actually decide to be disciplined and to get their disease under control. Now, the difference between, our real goal for patients is to essentially get them to be in a state of health. What was your lifestyle like? What can we bring your lifestyle back to the point where we're not diabetic anymore? So we may be 40 years old. We may have gained extra 20 pounds since graduated. It's very likely that we're going to need you to get your body right back to that same state. When you were awake, when you were at a lifestyle where you're at a lifestyle where you're not experiencing these diseases. And what happens is individuals are going through life. They have family, they have jobs, they have kids, and essentially things that make them not worry or not take care of themselves. And at the end of the day, preventing diabetes, which is very important, but treating, and as of recent, what we now can do is reverse diabetes. This all comes from a major factor of self-care. Now, many individuals, they get diagnosed with these diseases, and as a result, they may feel like it's the end of the road. What am I going to do? Individuals have significant psychological stress because they are worried about dying, they're worried about their family, they're worried about social pressures and, for example, what are friends going to think about their diabetes, and then other aspects of their own lifestyle. Individuals don't want to wake up every single day scared to eat food, and this happens a lot. We see our patients, and because we've been in Eleuthera for about 2 years now, and we've kind of been the major healthcare facility over there, and because we do lots of health promotions, because we believe in wellness, not just medicine, we believe in wellness. So a lot of individuals on the island are becoming aware of this wellness style of thinking. Individuals are hearing more about exercise and diet throughout individuals in the community and through social media more than ever. So we have lots of people knowing and deciding within themselves they want to get healthy. And those are the individuals that oftentimes are so worried about how to actually get healthy. And that's the major problem. I can't find a single person that doesn't know what's good for them. For example, you could take 10 people out of this audience and you ask each one, which is healthier for you to drink, soda or water? Everyone's going to say water. You ask individuals what's healthier for lunch, fries and a sandwich or a salad with some protein. Everyone's going to say salad. Fruits as snacks, or chocolates and cookies and snacks. Everyone's going to say fruit. So there's no mystery of what's healthy, what's not. Everyone's going to choose exercise, say exercise is better, not exercise, and going to bed early is better than going to bed late, right? So why isn't everybody healthy if everybody knows this? The problem is we don't know how to get healthy. And the individuals that are the head of our healthcare society, the physicians, individuals go to doctors for health, but they're not stepping on any stones or anything like that. What happens is, and what our society is actually doing is individuals are going to doctors to be managed, to essentially not get much worse, but not get much better, just to make sure that they don't end up in hospital or complications. Now, obviously, doctors' major goal in life is to keep individuals healthy and well, right? So it's not that doctors don't want individuals to be healthy. The problem is individuals are coming to doctors when it's almost near too late, and doctors don't necessarily like that either, right? Now, the question is, how do we get healthy? And the thing is, the physician actually just is not trained to help individuals get healthy. Physicians are very good at explaining what's wrong with the patient, what their course of treatment is, what likelihood they have of being successful within this treatment, what symptoms they may experience, and they can oversee and manage essentially the whole thing. But when it comes to actually getting healthy, individuals need to trust in someone that's trained and actually has the personal experience of getting themselves healthy. And so we saw some interesting studies. We're talking because we have a physician, all of the physicians in our clinic, we have a medical group chat and we have weekly meetings and we discuss various topics. And one topic at one time, essentially we talked about how one of the major reasons patients aren't given wellness advice, in other words, advice to eat healthy, advice to exercise as often as they should, and in the ways that can actually result in change. In other words, a doctor could say, yeah, you need to lose 20 pounds. And then that's the last time you speak of it until next year for your annuals. It's very unlikely that you're going to lose that weight unless you're a really motivated individual. So, and what the study shows is that many patients actually aren't healthy because their actual physicians don't take on personal health choices. In other words, your doctor is very likely also eating unhealthy, also not exercising, and essentially not a part of a healthy lifestyle. So what the study shows is that when we actually make changes in the physician's habits, we see that they become aware of how individual foods react with their health. For example, how their blood pressure goes up and down and their blood sugars. We see that individual physicians are more effective at helping their patients make healthy changes. Now, we at the Bahamas Wellness have the best of both worlds. All of our physicians are pro-health, and we have a health coach and nutrition and wellness system to actually take patients from a state of disease to a state of wellness over a certain time period, and every single patient would be aware of what that time period is based on their health habits. So step one, I think we need doctors to get a little bit healthier, take their health under control, and focus on themselves more so they become more aware of what the new science is saying about health, what the new science is saying about different food groups, so on, and exercise, so on and so forth. Now, second step, how do we actually get healthy? The first step is always we have to identify your goals. Individuals, so what is your goal? So in the context of diabetes, we're going to say we want to get our sugars from a state of being super high, like 200 or 300, to a lower level in the normal range. So then the question is for most patients is, well, how long does it take, right? How long will it take? So essentially, everyone is different. And individuals that have these health issues, they're going to need to know, hey, how long do I have to eat or exercise like this in order to get some improvements? Now, additionally, we're going to need a realistic goal. That's why individuals are going to need trained personnel to help them assist with their health improvement, because someone could easily say, I feel like losing 100 pounds. I'm 200 pounds now. I remember for example, if I'm a female, before I got married and had kids, maybe I was 120. And just like, I want to lose 80 pounds by my birthday, and their birthday is in 3 months. So that may be an unrealistic goal and that may not work out, not that it's impossible. So individuals need to be aware of which goals are realistic, how long it will take, and what that goal is. And then secondly, a game plan. Yes, everybody knows that, hey, I got to eat healthy and exercise in order to get healthy. But what specific change can we make to this individual to make this plan seem personalized, to make them feel like, hey, this is actually what I need to do. I need to do this amount of walking with X, Y, Z amount of minutes daily. All of my meals need to be about this size with these foods on the plate. It needs to have veggies, it needs to have protein, for example. It needs to have X, Y, Z amount of carbs. And so when a patient is given that structured strategy and program in conjunction with an individual helping them go through the various levels, we see that almost 9, and it's really higher, but I can't add decimals, 9 out of 10, even higher, 9.5 out of 10 patients are actually able to significantly reduce their symptoms. And just as a prime example of a patient I just saw last week, Saturday in Eleuthera, right? Older lady has had diabetes for a number of years now, we call them an insulin-dependent type 2 diabetic. So she's similar to Miss Davis. She has to take insulin in order to help her body turn food into energy. Now, what often happens is there are lots of times where when a patient starts needing to go on insulin, it doesn't necessarily mean that their body can't produce the insulin on its own. It oftentimes means that the body can't produce the amount of insulin you need based on this super healthy lifestyle that you're living. So this patient, what we did is and she had a number of other health issues. one of the vice president of the company, Dr. Culmer, he referred her because she had some health issues that we wanted to aggressively attack. And hypertension, diabetes, high cholesterol, obesity, and joint-related issues, which are some of the worst, because imagine being overweight, knowing you need to exercise, but now you have pretty much arthritis, so now you can't do the necessary movements you need in order to achieve your health goals. And some patients, that could be very daunting. So what we had to do is we had to outline a strategy to show her exactly how every step of the way, every one of her health ailments, we actually have a plan for. And so we started on that right away. And her blood sugars were in the range of like 300 to 400 generally. And she texted me, I think that was Tuesday morning. And she texted me on Tuesday morning saying that this is the first time she saw blood sugars at 167 in years. And that's not our target. We're going to get her much lower than that. We're going to continue to work with her. But she made drastic improvements pretty much over the weekend, right? So she decided that we gave her a meal plan, we gave her an exercise strategy, tell her what time she's going to sleep, which supplement she should be on, which medication she should take. And what we did in addition, we made sure she wasn't taking too much insulin. So oftentimes patients aren't exactly sure how much insulin they take. They kind of wing it. They're like, some days if it's extra, if it's a little high, they take a little extra. If it's a little low, they take a little less. And there's no real standard system. So what we did was we put a sliding scale in place so she knows if my blood sugars are between 200 and 250, I need to always take this much insulin, essentially no matter what. So and in doing that, we already drastically cut the amount of insulin she took by like 50%. So like she left the doctor's office knowing that she already is an improvement. She's already taking less medication. And over the weekend now, we've actually, because she's so good with her diet, she's eating every 3 meals a day on time, very good, very anti-diabetic meals, I should say. And now her numbers are much better and she's excited to keep moving forward. And that's often what's needed. Individuals, when they have had these health issues for so long, sometimes they need that little glimmer of hope to know that, okay, this was a weekend, but I got this much improvement in a weekend. I could do this for 6 months. Oftentimes when individuals aren't aware of the experience or what they need to do, it's very hard for them to commit to something. So we try to give individuals those small stepping stones for them to continuously achieve. So we try to use lifestyle medicine. We use standard modern medicine, contemporary medicine. We use health coaching strategies to keep individuals consistent with their routines and habits. And we continue to try and support their change based on their overall lifestyle. For example, things like the mom in the family may be doing good cooking her meals, but she also has to cook a secondary meal because the husband don't want to eat rabbit food, for example, or something like that. And the kid's not into that type of food. So as a result, sometimes we have to talk to the entire family, just make sure every step of the way that is in the right environment to support positive change. And 9 out of 10 patients, we always see significant improvement. And I have never seen a patient that doesn't have the ability, a type 2 diabetic, that doesn't have the potential to reverse their diabetes within a year. And we've seen some very, very bad patients, especially in the Luthra. And so this message is supposed to act as hope, to suggest that if individuals here have diabetes, that you don't have to be afraid. There's a bias people do sometimes where they think that, if they don't think about it, eventually it'll go away, and they keep procrastinating about it. That's never the case. It's just going to get worse. So if you can, and if you feel like, this is the right time, definitely talk to a physician, talk to a nutritionist, talk to a health coach, so you can get started on your health journey today. So now, if we do have time, I'm going to open the floor for questions for 5 minutes. So it's 12:55. We have 5 minutes of question times if anybody would like to ask any questions.
Hey, Justice, we doing the active workout? Remember you were supposed to do show us some things what diabetics should be doing. Simple workout. This is supposed to be interactive.
So the interactive, I remember I thought the interaction would be the questions. I wanted to be a more informal topic without like a presentation and PowerPoint to ask, so we could have more question time. I actually wanted to split it 50-50 with questions, but I got a little carried away.
Oh, we actually here in our workout clothes.
Oh, for real? Okay, well,
So you have to do something spur of the moment.
okay, so yeah, we're gonna do something right now. So back to the most important thing is goal setting. And what I think most of all individuals need to make the internal mental decision that they're going to achieve their health. And I think the best way, not I think, sorry, and the studies have shown, and my personal experience, one of the best ways we can get ourselves ready to consistently and daily achieve our goals is through meditation. So what is meditation, right? So the first thing that comes to mind, someone may think of like a Buddhist monk somewhere, like with smoke and, funny hand positions and sitting in uncomfortable positions. But that's not necessarily what meditation is. So studies have shown that meditation can actually directly impact your stress levels, impact our mood, impact our overall physical well-being as easy and as quick as actually one exercise. So, and I'll take it from my own personal experience for a quick second. I've done it all. I've been like vegan, I've lifted weights, I've done every form of all the crazy supplements, all the fads, everything. I've been through it all, I've done it all. I try all the new supplements, everything. And the one health practice that has consistently made my life way better and overall is meditation, daily meditation. So you can meditate. So if you guys, since you're wearing your exercise clothes, you could, pull out your lotus position if y'all know what that is, and do the whole leg folded thing inside and we can meditate for a quick second. I can show you guys a meditation technique that's super quick, super easy, and you don't have to feel like a monk trying to focus because that could be a little difficult. So y'all ready to try that out? Is this interactive and exercisey enough?
Yes, absolutely.
Okay, sounds good.
Yeah.
All right, so I like to call this the 5-7-8 method. And when you Google it, you see there are various versions of this. One of the first people ever talked about it was Dr. Andrew Wield, and I think he calls it the 4-7-8. So, and we'll keep it 4-7-8 to make it easier. I think the 4 is a little bit easier. So what we do is we inhale for 4 seconds. You take a big deep breath in, and we count to 4, and then we hold that for seconds, right? So we hold it, you count to 7, and then we exhale slowly for 8 seconds. So I'm gonna demonstrate first. So So the real goal is to slowly inhale, feel all that air, kind of fill up your lungs, hold that air in your lungs. It's going to be a little hard. And then slowly over 8 seconds, we kind of let that air out. And we do that with our eyes closed. My initial recommendation is always 5 minutes to get started. But for therapeutic recommendations, so the amount that you would probably need to actually have an improved mood, let's say, improve mood, a little bit more energy, a lot more mental clarity, and a lot more focus throughout the day, I recommend doing about 15 minutes. And I recommend doing this now after my meditation, when my brain is more focused, when I'm feeling more centered, then I goal set and plan my day. And for a patient, what that would look like is we wake up in the morning, we roll over, we get a little glass of water if it's next to your bed. Or if it's not, then you stay in bed and you kind of let your mind, first let your mind wake up, get alert, and then you stay calm, and then you do your breathing exercises. We go in for 4 seconds, we hold for 7, we exhale for 8. We do that for 15 minutes. You got the timer on your phone go off. And then after that, you can take out a notepad. I like to use my notes on my phone, and I literally write out my goals. Now, I'm gonna make an example of a combined goal list. So like someone that's worried about their health actually is So the first goal would be meditate. Next goal may be 15 minutes of exercise. The following goal may be make breakfast, get the kids ready. Third goal would be anything where we have to complete at work. So let's say you have some tasks at work that you're already aware of. You highlight them, we write them down, we tick them off. And we make sure that our lunch is accounted for. We make sure we know what we want for lunch. We know what we want for dinner. That way there are no surprises. And what we see is that your day is much easier to go on autopilot. You have a lot less stress associated with being well and making healthy decisions when we do things that way. So I try to being consistent and making plans. And that's how you're going to keep yourself accountable and make yourself aware of your own goals. And it makes achieving the goals way easier. So I like to say meditation just turns everyone's brain into like super brains, right? We get more focused, we get more empathetic, we get more connected to people, we become more aware, we better sleep, better health. And there's actually been studies on it. When we meditate, our brains and our being, we're just better at doing the right things for ourselves. We're just better at survival all around, right? And that's one of the major things in life, to survive. So, and on the big scale end, survival could just be getting by. But what the studies are kind of highlighting, the story that I'm getting is that when we meditate, we survive a little bit more effectively, much better all around.
So Justice, can we turn on the cameras and actually go through maybe, I guess. Maybe
you took the words right out of my mouth. So yeah, we could, let's do about 5 cycles of that, right? So we should feel a little something, everybody could leave feeling a little well. All right, so you guys don't have to turn your cameras if you don't want, you can if you want. Oh, I see everybody cameras on, okay. All right, so let's get started. All right, so everybody ready? So I like to, so everybody close your eyes. Let's take a deep breath in. Deep breath out. We're gonna take a deep breath in through our nose. Very deep, very strong. And we're gonna exit, we're gonna push it out of our mouth. We can do this a few more times with our eyes closed. Nobody looking at me, I'm looking at everybody though, okay? Inhale again, you go. Inhale. Big exhale. Now I'm gonna start talking a little bit more quietly. So what this initial warm-up does is it kind of gets the mind focused. So what we know, what the studies show, and if you ever read anything on meditation, you see that our awareness is very connected to our lungs. Essentially, one of the only things we don't control that we can actually control our breathing. So it connects your conscious and subconscious mind very well, because your breathing is normally done subconscious, unconsciously, and we can actually also control the conscious. So it provides the perfect connection of your subconscious and unconscious mind that you could do like by yourself, right? And it gets the focus there. Without doing those initial breathing exercises, our mind gets a little scattered. We could think about all those various things. And after those few deep breaths, you could kind of feel inside yourself a little bit more. So since I did all that talking and probably took you guys out of those good vibes, we're gonna do a few more of those, okay? So if we can take one big deep breath in, inhale, exhale, inhale, exhale, inhale, exhale. And we're gonna take a slow, deep breath for 4 seconds. On your own time and pace, we're gonna hold it for 7 seconds. 1, 2. I'm gonna let everybody kind of do that in their own head. And we're gonna exhale slowly out of our mouth, and we're just gonna kind of let the air flow slide out through our lips for 8 seconds. When everybody's done, let's all start again. Let's inhale. Let's hold. Let's exhale slowly. Let's inhale. Big deep breath slowly. You're gonna hold that. We want to be focusing all our awareness on our chest, that internal, we literally are our breath and our lungs for this exercise. That's all we're thinking about. Anything else that comes to mind, we just go right back to focusing on our chest, whether it's the process while we're inhaling, the process of feeling that air inside your lungs while we're holding, or the feeling of the air running through your lips as we exhale. So we're going to do that again. We're just thinking about the air hitting our nose on the inhale. We're just thinking about that tightness in our chest while it's expanded on the hold. And we just feel the air leave our lips on the exhale. So I want everybody's eyes to stay closed. You take another inhale and a slow exhale right after. You could do one more inhale and a slow exhale. Now I want everybody to keep their eyes closed and just think about their Monday. I want you to just imagine all the things you got to do on Monday. The more detailed, if you're a detailed person, be detailed in your own head. You know, if you're not as much, you know, be less detailed and just see what you have to do and kind of write that mental list and, you know, see all the things you have to do. And what happens oftentimes is you kind of see a clearer picture. You don't feel as stressed. Sometimes we think about the things we do and we get that immediate internal feel. And so what that really is like the psychological mechanism of procrastination. Whenever we're stressed about a task, we want to procrastinate. And what we know from through science is that your brain has three modes. In this sense, we have fight, we have flight, or we have plan. And what often happens is, and it's pretty cool, we actually can't be stressed about something we have a plan for. It's much harder to be stressed about something that we know exactly step by step what's going to happen. And so what really that stress is your brain not knowing what's going to happen. And so we could take this time to plan out our day and let our brain know what's going to happen, because we're going to control our day. And that's what this meditation is for. So we're going to take on that same note, we're going to take another inhale, a nice big inhale. And a big exhale. And I want us to keep our eyes closed. And, you know, I like to, and this is Rotary. So I know this is made up of a lot of high achieving individuals in various groups in our society. And if you look at some of the top performers around the world in their various fields, meditation is so normal and wide used now. And I think it's one of the first things you could do every morning to continuously be a top performer. And I say it's out of every healthy habit I've ever done for the betterment of myself, I'd say meditation has always been number one. It's all optimum self-care. So we're gonna close out now with a big inhale. We're gonna hold that for 4 seconds. And then we're gonna exhale. We're just gonna slowly exhale until everybody has all the air of their breath out their lungs. And you could just sit in stillness for a few more seconds if you want, and then we can open our eyes after. And we can have someone share their experience if they would like. Anybody, you don't have to all fight to rush at once. How are we feeling, guys? A little tired, a little sleepy? And so what you're going to notice is after we leave this talk, you may be a little tired, a little sleepy. So what that is your brain waves. So we have a few waves. We have a faster pace at beta waveform, and then we have alpha waves. And when we meditate, we slow things down. We bring our waves to delta waves. And so you can feel a little more tired. But what you're going to notice is throughout the day, everything just seems a little bit easier. The day just flows a little bit better, so on and so forth. And it may be different experience for everybody. If you're more stressed on this call, then you may not notice the direct response as easy. If you're less stressed, you may see. But yeah, I'm feeling good. I'm feeling energized. I was tired initially before the meditation, after the talk, and I'm feeling good now. I may go do something after this. So if anybody wants to share their experience, they can. I'm going to mute my mic now.
I see El Ramming has the hand up to share.
Yes, good afternoon. I'm actually feeling sick, and doing the exercise, it helped to loosen up some of the secretions in my lungs. And I started to cough up, and so it's expanding the lungs and the alveoli and stuff, open up the air sacs, and I feel, a little bit better. And I sure if I check my O2 sat now, it should be better. especially if you go by the beach. It's beneficial on the whole. So thank you.
Yeah, for sure. So my grandmother actually, and this isn't to talk about COVID or any ulterior treatment of COVID, but I remember my grandmother had COVID and we were monitoring her oxygen levels, and we'd ask her to do some deep breaths and meditation for a while. And I could watch the oxygen on the finger go up. So you're definitely right about that. If you think that your oxygen O2 saturation is going up, it can go up a little for sure. Now, that's definitely not to be taken as alternative treatment for COVID. So if anybody else wants to share, or if not, I'll pass this floor back over to our moderator.
It's more relaxing. I feel much more relaxed right now.
That's good. That's solid. I'm glad to hear it.
Justice Brown, would you be able to give a trivia as well to that to the audience?
Like a question?
Yeah, if you want to give a trivia to the audience as well.
Okay. If I'm a diabetic, what food group should I try to blood sugars? And I'm going to pass the question over to the floor. Should I repeat it? Is the question good? If I'm a diabetic and I want to get healthier, which groups of foods should I try to avoid?
Carbohydrates.
Or reduce?
Carbohydrates.
And yeah, so the carbohydrates is the answer. So we see that, you're a diabetic and you could test this at home. We take the 3 food groups, fats, carbs, proteins. If you eat a piece of chicken one day and you test your blood sugar, you're going to see much less, a little movement. If you drink a tablespoon of olive oil, you're going to see almost no movement. If you do a tablespoon of sugar, you're going to see a whole lot of movement. So there's no secret as to what raises our blood sugars, and there's no secret as to what we need to remove lower.
So that was Ann Minnis who answered that? Who answered the question?
Yeah, Ann Minnis put the response in the chat because I think Veronica, was the one who responded, but Veronica already got a prize. So Ann Minnis put a response in the chat.
Okay, all right, thanks. I think the breathing exercise was excellent. It cleared my mind and get me focused and allow me to really think as to how my day should continually go. So I think the breathing exercise was very thought-provoking and very relaxing and therapeutic.
Glad to hear it. Glad to hear it.
Yes.
And meditation is best as a practice. So you're going to get more benefits the better you get at it. So the faster you get deep, the longer you can stay deep, the more you're going to notice the improvements throughout your day. All right. Thank you guys for having me.
Thank you very much, Justice Brown. Wow. Excellent, excellent presentation. At this time now, we're going to move into our question and answer period, our Q&A. So far, if anyone have any questions, they can raise their virtual hand or they can put it in the chat if they so choose. But so far, I just have a question for Ms. Melvern Davis. And the question is, can you explain hypo and hyper?
Well, hypoglycemia is when you're experiencing low blood sugars, and hyper is high blood sugars. Now, low blood sugars range probably in the maybe 60 and below, and high blood sugars when you're getting in the 200s and 300s. That's me. Different people vary, but that's me. When I feel like I'm in the 200s or going up to 300s and stuff, that's very high. So that's hyperglycemia. And the lows, when I'm in the 60, I'm low. See, it's hypo. I'm low.
Okay. Thank you for your answers, Ms. Davis. Any more questions? You can put it in the chat or you can raise your virtual hands. We will allow you to unmute. Any questions?
I have a question for Justice Brown. In doing the exercising, for diabetes, is it possible to burn too many calories when you're exercising?
So to be honest, I don't really subscribe to the whole calorie model of weight loss or dieting at all. There are lots of studies to show that we kind of got it all wrong because, prime example, if you take 100 calories of broccoli and 100 calories of soda, it's still both 100 calories, but the average person intuitively knows that they're going to respond in the body. Right? One of them you got to chew, one of them you could actually pass out, one of them you're going to pee out, right? So like everybody knows food responds in the body differently. And so we see also for exercise is that it's not necessarily the amount of calories you burn, especially as a diabetic, is doing the right type of exercise to make your body better at burning sugar. And so for diabetics, that tends to be either weightlifting or higher intensity exercises. So things that make your heart rate go up a little higher or things that make your muscles a little bit bigger.
Okay, thank you.
So,
any more questions? Please feel free to type it in the chat or raise your virtual hand. I think I may have a question for Dr. Lightbourne. I know you was talking about healthy lifestyles. If I am dependent on insulin and I start eating healthy, exercising, getting my body in shape and so forth, would I be able to automatically come off the insulin? I think you might have mentioned it in the chat, but is that possible? I know you think, I think you did say yes, but.
Excellent question. And I have no problems repeating that one because that's probably the most important question asked. And the answer is I wouldn't say automatically, but definitely it is possible very quickly within you engaging or beginning your lifestyle program for you to come off of insulin. Particularly once we have enough evidence to show that your body is making sufficient insulin. And in most patients, they are. As Justice indicated, it's really about reducing your body's need for the amount of insulin that you require to move sugar into the cell by reducing the things that raise sugar, such as reducing foods that turn into sugar, reducing cortisol, which converts fat into sugar, and the other triggers that exist. Once you control those elements, we have seen dramatic falls. We've seen patients become severely hypoglycemic, and we were forced. And I like to tell patients, it's not that I take you off of insulin or any medication. We work to eliminate your need for it. And so much so that it is dangerous to keep you on it. And so most of our patients, they get so much better that I would be a very bad doctor if I leave them on that drug, because they're actually worse off with the drug because their numbers have improved so dramatically. Hope that answers the question.
Yes, it did. Thank you very much. Thank you. And for Katina, I have two questions for you. One, I want to know, is it possible you could upload the recipe to the chat so persons may want to know it? And my other question is for an everyday quick snack and meal. You might be able to cook a nice healthy dish every day or for lunch or breakfast or dinner. What kind of quick fix recipes that you can probably make, I think within less than 2 minutes, that we can use?
Okay, I will upload the recipes. That's not a problem. At least I'll send them to you because I have them in PDF. Something quick, I usually eat peanut butter, to tell you the truth, just a teaspoon, because it keeps me satiated. And I like peanut butter. It's no sugar added peanut butter. It's all natural. And that's my go-to, sometimes with celery sticks or apples. And that's very quick for me to prepare.
Oh, and I also like this question, if I can add to what Mrs. Cesar said already, which is really that I like to reiterate the fact that most of the bad foods that we currently consume, which have taken over the food industry, have been created on that very same consumer demand point that you made. I want something quick. I want something on demand. I want it now. Because we have reduced our lives to, pockets of self-care, and the rest of it is get things done. Just keep going. Just stay on that sort of treadmill of a rotation of life. And one of the best advice I try, the meditation exercise that Justice said and already, is slow down. Slow down. Let's not constantly be trying to squeeze more things into our day. Let's focus less on quantity and more on quality of life, high quality foods. Get back into the kitchen, start preparing meals as a family or with loved ones. These have a myriad of benefit, because not just does it causes you to have healthier meals, but it reduces stress. It causes you to develop stronger bonds, and all of these relationship benefits have psychological impact on cortisol production. And we've got to get back. I'm trying to stop us from moving full steam ahead towards this high pace lifestyle, and get us to understand that what we need to do is slow down.
Thank you for that, Dr. Lightborn. I have two questions there, one for Dr. Dervin Monroe and one for Dr. Dean. I'm going to start with Dr. Monroe. And the question is, how often should we schedule a dental checkup?
Well, for diabetic patients that are well controlled, 6 months is usually adequate. Those individuals that are not perhaps well controlled, they should perhaps have their teeth cleaned and checked about every 3 to 4 months.
Okay. And Dr. Dean, the question is, how often should we schedule a vision checkup?
For patients initially, if they were just diagnosed, like I had said in my presentation, you want that initial diabetic screening to ensure that everything is okay. If everything is okay, annual checkups are necessity. If there is any findings there, like early changes, like what I had spoken about, diabetic retinopathy or cataracts, I may bring patients in a lot quicker. So it depends on what I'm seeing. Sometimes if there's some early changes in the retina, it may be 3 months, it may be 6 weeks, but it all depends. But if everything is under control, annual checkups.
Okay, and thank you, Dr. Dean. This question may be tied to both Ms. Sayers and Dr. Lightborn. For you, is that true? The least amount of items on the, I guess that's the label of the food, the healthier the item will be for you. This could be for Dr. Lightborn or Dr. Ms. Sayers.
Go ahead, Dr. Lightborn.
Okay, I thought you was gonna get that one. No problem. So single ingredient foods, that is your aim. The takeaway message is eat real food. Eat real food. Foods that have no labels. I don't bother teaching patients to read labels, because I tell them, don't buy anything with labels as much as you can. But if you do, look for something that has a maximum of 2 to 3 ingredients. And make sure sugar or none of the family members of sugar is one of those 3. But the take-home message for me that I teach patients is eat real food. Foods that grow on trees, food that grows from the ground, whole organic meats, meaning non-processed, not healthy raised meats and eggs. Eat real food, and you will be 60 to 70% on your way just by doing that. as it relates to nutrition.
Thank you, Dr. Lightborn. And for Dr. Monique Mitchell, I've noticed a lot of persons, who having to remove a toe as a result of diabetes. In a lot of instances, after they're removing their toe, they end up passing away. Is that a common thing, or what would you suggest in circumstances like that? Is there another way instead of amputation, or how could we avoid having to go through that? Because it appears as if to remove the toe will be like to correct the problem, but the end result normally ends up in death. From what I've noticed on quite a number of patients. Could you just expand on that? Whether or not it may be beneficial to find another route to amputation?
Okay, yes, good afternoon. Well, I could definitely answer that. There's definitely a better way. The reason why it seems that persons get, a lot of persons die after an amputation is because that is true. Having an amputation increases the risk of death following an amputation is very high. In fact, it's higher for persons with a diabetic foot ulcer or an amputation, higher than persons who have breast cancer and prostate cancer. So it's around almost 70% of persons will be dead in 5 years after having a lower extremity amputation. So it's very high. Now, the reason why persons end up with an amputation, I spoke a little bit about it in my presentation, is because of the changes that occur that has to do with the blood flow. Well, first of all, the neuropathy or the loss of sensation that results in them getting an injury that will progress maybe to an infection. There is not enough blood flow to heal the infection and then heal the wound, and then it may eventually end up into an amputation. Of course, we know a number of persons spoke about the impact of the diabetes on the way persons seek care or have access to care, because they don't feel the pain or they don't recognize that the injury has occurred. Sometimes there's a delay in presentation. And so that also leads to the bad outcome in terms of the amputation. So what would be the best way to prevent that? Of course, would be to have preventive care. Both Dr. Dean and Dr. Monroe spoke about when persons should get their eyes and their teeth checked. And so the same thing applies for podiatry. We love it when the person comes in when they're diagnosed, and there's most often with type 2 diabetics if their primary care sends them in at the time of diagnosis. So that is fantastic. And then we're able to do a foot screening, which categorizes their risk. And then based on that risk level, they're scheduled for a follow-up visit based on what we find. If they have issues, like for example, the neuropathy, they may have a deformity, they may have blood flow issues, then they may come back within a couple of months or 3 months. If they're fine with good blood flow and sensation and everything is intact, then we may schedule them for a year. But it's based on what we find at the time. And then of course, the patient has a responsibility to also help to prevent an amputation, and that it requires that they're looking at their feet every day and that they're not putting their feet in a situation where it can be injured. And then they're seeking care as quickly as they can if there is a problem. So I think all those strategies, of course, with controlling the diabetes in the first place would be the best way to prevent that amputation.
Okay, thank you very much, Dr. Mitchell. If there are no more questions, I guess then we can move on. I'm coming now to thank our presenters and everybody else who have played an instrumental role in putting on this webinar. Is our Rotarian, Dr. Rashan Wallace.
Good afternoon, everyone. Can you hear me?
Yes, we can.
Okay, thank you. This was such a wonderful presentation or webinar. I should say. I would like to thank Dr. Lightbourne, Dr. Anita Dean, Dr. Monroe, Dr. Monique Mitchell, Mrs. Sayers Lockhart, Justice Brown, and Melvin Davis. On behalf of the Rotary Club of Nassau, our family, we'd like to thank you for the time that you have taken out of your busy Saturday schedule to bless us with this wealth of knowledge, to bring about awareness in our community, to bring and help to strive to achieve primary and secondary prevention. I'm really appreciative to be a part of this today. It just helped me to, I myself have been training to become a diabetic educator. So it just helped to push me to get back into the reins and get on with it and to help the broader community. I just want to say, to harp on Dr. Lightbourne's point, that we need to really slow down and consider taking care of ourselves, because if we don't take care of ourselves, or we can't take care of ourselves, we can't really be there to care for anyone else. And another side note, I just want to put a testimonial out there for Ms. Sayers Lockhart. Back in 2018, after my first daughter, postpartum, you're depressed, you gain so much weight and it's hard to, lose. I'm not a diabetic, but she is a family friend of mine, and I reached out to her, and she is such an awesome health coach. In a month, I was disciplined. She gave me a whole 30 plan. I just focused on eating clean, and I didn't even exercise. Within that month, I lost 20 pounds alone. So it just goes to show, with proper eating and exercise, diet and exercise and discipline, you can do so much more. So again, I'd like to thank all of the presenters, and I hope that this is something that we could do on a more frequent basis. Again, thank you from the Rotary Club of Nassau.
Thank you very much, Dr. Wallace. And ladies and gentlemen, we have had a full, or almost a full day of wealth of information and knowledge. Yes, some fellow Rotarians and members, and ladies and gentlemen, we have had a full day of this webinar, and I trust that you were informed from the education and the knowledge given. But like they say, all good things must come to an end. And so I want to thank you for being a pleasant audience. And I wish you all the best and safe holidays to all. Thank you.
Thank you.
Thank you. Enjoy your day. Thank you.
Thank you, and happy holidays.
Wonderful presentation. Thank you.
Extremely.
Thank you, everyone. Beautiful, beautiful presentation. Enjoy it.
Excellent. Have a good day.
Good afternoon, everybody.
Thank you. Good afternoon. Waiting for the next one. Waiting for your next presentation.